Sir, we are live now. We can start.
Okay, thank you, Kunal. Thank you, Shubham. Thank you, Apurv sir, for your wishes. प्रणाम दोस्तों, स्वागत है आपका सेरिबेलम यूट्यूब चैनल पर। दोस्तों, आज मैं आपके साथ करूंगा 100% PSM रिवीजन। फ्रेंड्स, टुडे आई एम गोइंग टू कवर all the 100% PSM course in a very concise, quick manner with you. You just have to be alert. Now, friends, before we start, I know around 8 days are left for FMGE exam. 7 days, I should say. Give your 100%. This is not the time to quit, but this is to keep your car in the final gear now. So don't relent. Just simply go on relentless. Just keep on putting your 100% efforts. This is the time to strike the final blow. Final hammer throw. You have to do it now and go for the gold. NEET PG students, many are asking NEET PG aspirants, sir, should we join this session? Yes, friends. National Board of Examination is the common body for both the exams, FMG as well as NEET PG. I've seen in last 7 years, so many questions have been jumping between the two exams. So definitely you'll have to go through this session. Also, last 3 years, if I look, there were at least 3 different FMG exams which are slightly more difficult than the NEET PG paper itself. So definitely it will benefit you. It will help you revise everything in a concise and a very fast manner. Dipanshu Grover is asking, sir, please PDF after the class. Yes, friends, I'll give you the PDF. Trust me, no one reads PDF, but I'll give you PDF. No doubt at all. Bear with my voice today, friends. Okay, friends. So let us start. Welcome to Cerebellum. Let's get our balance right for the upcoming FMG exam on 20th of December. 100% PSM revision session. Pranam dosto. Let us study together. And friends, as we said, Cerebellum, idea is to give a comprehensive revision. So I'll try to revise 100% course today. I will give you all the latest updates. I will discuss all the images with you. Previous year questions will also make an appearance in this session. And in the end, there will be one rapid fire round to just energize you before the all important examination. Friends, before we start, in case you have not subscribed, this is the time. There is a red button on the right or the left side. Simply click it and subscribe to the YouTube channel of Cerebellum Academy. We will keep on coming to you with academic sessions non-stop before your exam, till your exam, so that your preparation is not at all hindered due to whatever is going on around. Right, friends? Okay, friends. So let us start. We start with the first question. An intern has to study relationship between ordering food online and development of obesity using a case control study. Which is the best study groups to be selected? So friends, go through this question. I'm waiting for your answer. I'm keeping my mobile in front of you. I'll go through the chat. I'm waiting for your answer, friends. Piyush Pushp says C. Khalid Rakesh, sorry, Dr. Khalid, Dr. Rakesh, Dr. AJ Chaudhary says C. Dr. Himanshu, Dr. Mayank, Dr. D. Mostly are saying C. Few answers D for Delhi I've got. Okay, friends, good to see most of us are marking. Dr. CID says A. Dr. Bashir says C. Dr. Shilpa Anand says C. Okay, friends, I cannot go through so many names. More and more students are joining. Now let us go through the concepts. See, concepts are also important. It is a case control study. So you need 2 groups. What is a case control study? You take cases control and then go in a retrospective backward direction. It is a retrospective study. So you start with cases and controls. Now, friends, you tell me what is a case, what is a control? Case is someone having the disease. Control is someone not having the disease. In this question, disease is obesity. And exposure history you are going to ask retrospectively is ordering food online. So answer to this question, as most of us have marked correctly, is choice number C. So we will take obese and non-obese group, and then we will go retrospectively backward looking, effect to cause, and ask how many of you ordered food online in the past. This will help us compare and draw conclusion. This is a case control study. In a cohort study, the two groups are exposed, non-exposed, ordering food online, not ordering food online. But in a case control study, we start with the disease. So disease, non-disease, obese, non-obese. So I'm very happy most of you have marked this correctly. This is an older question which appeared in the NBE FMGE exam recently. So good to see most of you have marked correctly. Questions will not be difficult, only questions will be a lot lengthy. So you have to just check which particular, see, I always tell, in case there is a long question, I'll share some quick smart tips also today. If there is a very, very long question, you're getting confused. First, read the last line. Last line says best study groups to be included. So you have to find out study groups. It is a case control study, so cases and controls. Good friends. Okay, तो दोस्तों केस कंट्रोल स्टडी, सम स्टूडेंट्स आर सेइंग इंग्लिश आल्सो, तो दोस्तों केस कंट्रोल स्टडी में केस भी होना चाहिए, कंट्रोल भी होना चाहिए. ओबीज और नॉन ओबीज से स्टार्ट करेंगे और फिर पीछे जाके हिस्ट्री पूछेंगे ऑर्डरिंग फूड ऑनलाइन की. आगे चलते हैं. लेट्स मूव टू द नेक्स्ट स्लाइड. Okay, friends, identify the study design. I am waiting for your answer. Friends, we'll talk about cerebellum, but later. Right now, my whole focus is to help you complete the course. Class will be long today, friends. Till I finish the course, I will not leave. Okay, Dr. Prachi Dabas says it is a cohort study. Dr. Honest says it is a cross-sectional study. Dr. Govind Rai Garg sir is also there in the chat box. He will answer to you about cerebellum. Okay. Dr. Aniya Trivedi says it is a case control study. Dr. Tokyo, Dr. Khalid says cohort study. Most of us are saying cohort study, but friends, many of us are saying case control and cross-sectional. See, I just told you what is a case control. Case is control, then go in a backward direction. What is cohort study? You start with exposure, go to the outcome. Exposure to disease, risk factor to disease, exposure to outcome, cause to effect. So we start with exposure, non-exposure. So this is a cohort study. Now also there is a very good clue given in all the images. You can see studies starting with exposed, non-exposed. Also look the direction of arrow. It is going towards the disease. So we are going from exposure to disease, cause to effect. So this is a forward looking, this is a prospective study, cohort study. Now friends, you tell me, how do you calculate your results or strength of association in a cohort study? I am waiting for your answer. Cohort study, the strength of association is given by, waiting for your answer. MedLife India, Goga sir भी जल्दी live आएंगे. Dr. Honest Doctor is absolutely right. Okay, very right. It is, many of us are marking correctly, relative risk. Cohort study, the strength of association is relative risk. Case control study, it is odds ratio. What is the formula of relative risk? It is incidence in exposed divided by incidence in non-exposed. So this is your incidence in exposed. This is the incidence of disease in non-exposed. So if your relative risk comes more than 1, association is present. If your relative risk comes equal to 1, no association. If your relative risk comes less than 1, then definitely the risk factor is protective or beneficial for the disease. That is known as inverse or negative association. दोबारा रिपीट करता हूं हिंदी में. अगर रिलेटिव रिस्क 1 से ज्यादा है, एसोसिएशन है. अगर रिलेटिव रिस्क 1 है तो एसोसिएशन नहीं है. अगर रिलेटिव रिस्क 1 से कम है तो भी एसोसिएशन है, बट उसे हम नेगेटिव या इनवर्स एसोसिएशन कहते हैं. रिस्क फैक्टर इज प्रोटेक्टिव फॉर द डिजीज इन क्वेश्चन. ओके फ्रेंड्स, लेट्स मूव फॉरवर्ड. Now this is a question I am giving to you. I know you may not be given pen and paper. हो सकता है आपको पेन पेपर ना मिले, लेकिन फिर भी क्वेश्चन तो करना है. Calculate the strength of association in this case control study. First you tell me, अभी मैंने आपको बताया, I've just told you, how do you calculate strength of association in a case control study? That is by odds ratio. And what is the formula of odds ratio? AC by BD, AD by BC or AB by CD? I'm waiting for your answer. Okay, some students have started marking the answer. I'm happy to see that Dr. Pami Shetty Mamta has given correct answer. Dr. Tokyo, Dr. Yumeni, Dr. Raj Vasoya, Dr. Phenomenal, Dr. Kazi Saifuddin, Dr. Prince Bansal, all of you are right. Very right, friends. Odds ratio is AD by BC. If you get a rough sheet, you can mark. Otherwise, you'll have to think in your mind that this is A, B, C, and D. Look at the screen carefully. It is AD by BC, A into D by B into C. So you will have to do it mentally. A into D divided by B into C. So now you can see 79 is cancelled. 100 by 50. Odds ratio of this study is 2. I'm so happy. Many of the students have done a mental calculation. And mental calculation, you have to be mentally sound during the exam. Just keep your focus, friends. You're not going to lose in the exam. This is my guarantee. Dr. Bashir Qureshi has already answered the question I was going to ask next. What is odds ratio also known as? Look at the screen. It is a cross multiplication. So odds ratio is also known as cross product ratio. Now, friends, can you interpret for me what is the meaning of odds ratio 2? Just like relative risk. If odds ratio is more than 1, it implies association is present. So definitely asbestos exposure is associated with development of lung cancer. If odds ratio come equal to 1, no association. If odds ratio come less than 1, then definitely negative inverse association. Risk factor is actually protective for the disease. Very right. Absolutely correct. Dr. Zain, Dr. Reen, Dr. Vidhi, Dr. Khali, Dr. Piyush, Dr. Amritansh. I love your name, Dr. Amritansh. Dr. Dhruv, Dr. Satish Kumar, Dr. Kazi. Many of you are correct. Very right. Okay, friends, let's move forward. आगे चलते हैं दोस्तों. What is heart of a RCT? A very old question which has been asked in NEET PG also asked in FMGE exam. What is heart of a randomized controlled trial? Is it R, randomization? Is it C, having a controlled or a comparison group? Or is it T, trial of a new drug or vaccine? Dr. Doxycycline has answered correctly for the previous question. 2 गुना ज्यादा रिस्क है. Odds ratio 2, तो 2 गुना ज्यादा रिस्क है. बहुत सही, बिल्कुल सही. Okay, we have started getting the answer. Dr. RK Medicine says randomization. Dr. Aditya says randomization. Why, friends, you are answering randomization? Is the controlled comparison group not important? Is the new drug trial is not important? Friends, you are absolutely right. Trial is important, comparison control group is important, but the most important is the technique of randomization. In fact, a question has been asked. Non-randomized trials are not of value. It is the randomized trials which are of importance. What is the essential purpose of randomization in RCT? Randomization हम करते किस लिए? RCT में इसका फायदा क्या होता है? Randomization, the major purpose is to eliminate selection bias. This will ensure comparability between two groups. This will also ensure both the groups have similar prognostic factors. Sorry, friends, I'm not able to read every name today because so many students have joined today. So your answers are moving very fast on my screen. Okay. Yes, Dr. Raj Vasoya, you are right. It eliminates selection bias. It can help in minimizing confounding also. Therefore, it is better than even matching or blinding as a single method. So randomization is best. Therefore, RCT is better than cohort or case control study or any other analytical study. Good. Let us move to the next question. What is the unit of study in phase 1 of a clinical trial? Can I say, is it animals? Waiting for your answer. Also, you will have to tell me which phase also has same unit of study in a clinical trial. Okay, Dr. Guevara, very right. Pygmalion bias तो मैं आज करूंगा. पूरे प्रोग्राम में आज पिग्मेलियन बायस ही चलेगा. मैं आपको इतना मोटिवेशन लेवल हाई कर दूंगा कि एग्जाम तो सबका क्लियर होगा. गुड. ओके फ्रेंड्स, मेनी ऑफ यू आर राइटिंग करेक्टली, लेकिन ना आप इसका आंसर में थोड़ी सी टेक्निकली मिस्टेक कर रहे हो. जैसे डॉक्टर अमृतांश, डॉक्टर इनविजिबल, आप लिख रहे हो हेल्दी पेशेंट. हेल्दी भी और पेशेंट भी है, ये तो नहीं हो सकता, राइट? तो ही कैन नॉट बी हेल्दी एंड हैविंग द डिजीज एट द सेम टाइम. थोड़ा सा टेक्निकली से करेक्ट कर रहे हो. यू आर एब्सोल्युटली राइट. डॉक्टर रेन हैज गिवन द करेक्ट आंसर. इट इज हेल्दी human volunteer. Dr. Nitin Pachori has given correct answer. Many of you have given correct answer. Good to see. So it is healthy human volunteer. And my other question was, which other phase has healthy human volunteer as the unit of study? Anyone remembers that? That is phase 0. Phase 0 is used for microdosing. Phase 1 is used for safety and non-toxicity. Phase 2 is for efficacy, effectiveness in public health. Phase 3, many of you have written correctly, is randomized controlled trial, most important phase, phase 3. And phase 4 is the post-marketing surveillance, longest phase, infinite phase, minimum 10 to 25 years, to see long-term and rare side effects with a focus on long-term side effects. Very right. So Dr. Nida Safi, Dr. Kruti, Dr. Azad, Dr. Hashi, Dr. Amit, Dr. Haji, Dr. Hitik, Dr. Deepika, all of you are right. So happy to read it, friends. Let's go forward. So it tells me 1 week is left. Your preparation is going in the right direction. Let's take it to next level. Which of them is known as prevalence study and which is known as horizontal study? So I'm waiting for your answer. Just tell me. Prevalence study and horizontal study. अब की बार एफएमजी तो होगा क्लियर दोस्त, डेफिनेटली होगा डॉक्टर ग्यूबेरा. ओके, दोबारा सारे फेजेस इतने एक्सप्लेन कर देता हूं, इतने आंसर आते हैं फ्रेंड्स. फेज 0 माइक्रोडोजिंग, फेज 1 healthy human volunteers, like phase 0 healthy human volunteers. Phase 1 is for safety, non-toxicity. Phase 2, 3, 4 is on patient. Phase 2 is for efficacy. Phase 3 randomized controlled trial, most important phase. Phase 4 longest infinite phase, post-marketing surveillance, surveillance of long-term side effects. Okay, very right. Prevalence study is cross-sectional study. Study which is done at a point of time. तो क्रॉस सेक्शनल स्टडीज प्रेवलेंस स्टडी. और कौन सी स्टडी इंसिडेंट स्टडी होती है? विच स्टडी इज इंसिडेंट स्टडी? दैट इज कोहार्ट स्टडी. आई विल रिपीट, कोहार्ट स्टडी, इंसिडेंट स्टडी. Case control, neither incidence nor prevalence. Cross sectional gives you prevalence. So incident study is cohort study, cross section is prevalence study. Which is horizontal study? Dr. Priyanshu Pathak has answered correctly. Friends, any study which has a direction is horizontal. देखो, look at the screen. मेरी screen की तरफ देखो. My finger is moving horizontal. So either it is going forward or backward. So this will include both cohort and case control study. तो दोनों आगे या पीछे जा रहे हैं, horizontal. So cohort, case control study are horizontal in nature. Now look at cross sectional, ecological. They are done at a point of time. So cross sectional and ecological are vertical study designs. Horizontal studies are also known as longitudinal studies. Longitudinal means having a direction forward or backward. So cohort, case control studies are longitudinal in nature. Cross-sectional, ecological are non-longitudinal in nature. Good. Most of you are answering correctly. Dr. Rachna Rajpara, Dr. Shivam, Dr. Ali Azad, you are correct. Dr. Strange, you are correct. Pranam, Dr. Pramod Sharma, Dr. Jain मेरे namesake हैं. Mixed. Okay. चलिए आगे चलते हैं. Let's move forward. Okay friends, पहले तो आप मुझे बताओ कि कोविड की कौन सी 100% इंडिजिनस वैक्सीन इंडिया ने रिसेंटली लॉन्च की है और उसकी क्या यूनिक फीचर है? Which COVID vaccine has been recently launched in India and it has a very unique feature? Can you tell me? Yes, Dr. Shines, ecological is vertical, cross-sectional, ecological don't have a direction, both are vertical. Yes, Dr. रोहिताश, न्यूट्रिएंट भी आएंगे. मैं सीक्वेंस में चल रहा हूं ताकि आपके सारे टॉपिक सीक्वेंशियली कवर हो जाए. न्यूट्रिशन भी बहुत डिटेल में डिस्कस करेंगे. Okay, Dr. Chinmay, Dr. Bhokali has given correct answer. It is Incovac. So friends, now you tell me what is unique about Incovac. If you look at the screen carefully, इसमें drops हैं. This is actually India's first intranasal vaccine. And it is again 100% indigenous. Friends, this vaccine is recommended for age above 18 years. This vaccine has been made by Bharat Biotech. So Bharat Biotech has made this vaccine. In this vaccine, now the correct dose has been advertised by the government of India. It is 0.5 ml, but that will comprise of 4 drops plus 4 drops. So this is the latest addition, you can say, or latest development you should know. Total 8 drops, 4 drops in one nostril, 4 drops in other nostril. Total 8 drops, 0.5 ml. But for this vaccine, it is recommended there should be 2 doses, 4 weeks apart. Like most of the vaccines, minimum should be 4 weeks apart. It is an intranasal vaccine. But which type of vaccine this is? This is a type of non-replicating adenoviral. I hope you are noting this down. Don't just rely on PDF. Don't just rely on video staying on the channel. Whatever you write, passive memory, you will remember more. So adenoviral vector-based vaccine. And what is its unique feature? Besides being intranasal, this vaccine has been approved as a heterologous booster dose. That means if you have taken Covishield or Covaxin, you cannot interchange them when you require precautionary or booster dose, but you can take Incovac definitely as a heterologous booster dose and it will give you better protection. Next time, let's wait for some time when it is available, and when the precautionary dose comes, let's go for it. It will give us better protection, no doubt at all. Okay, Dr. Naruto, don't worry, Asha will come later. Okay, so heterologous booster dose also it has been recommended. It is India's first intranasal vaccine. Let's write the word because this is a proud feeling. So this is India's first intranasal vaccine. You should also know, definitely you are going to be asked in the exam about Covaxin. So Covaxin, quickly tell me these answers. Which type, strain, dosing? Just tell me the strain. Type, I'm sure you must be knowing. This is 100% inactivated vaccine. Whole virion. Anyone who can tell me strain? Yes, Dr. Nitin Pachauri, all the vaccines come under primary level specific protection. You're absolutely right here. Yes, BB152, this is also manufactured, has been manufactured by Bharat BioNTech. Incovac was BBV154. This is BB152. Strain I'm waiting for. That cricket guy has given the first correct answer. Strain is right. You are NIV 2020 770. And doses I'm sure you know because many of you have taken. There are 2 doses, 0.5 ml each, intramuscular. What should be the gap? 4 to 6 week, intramuscular deltoid. Can anyone tell me what is the USP, unique feature of this vaccine? Sorry. Yes, you are right, Dr. Priyanshu, Dr. Javed Khan, Dr. Chanchal, Dr. Cricket Guy. Dr. FOMO, don't be na FOMO, but you are right, dear. Okay. Okay, post-vaccine side effects, let's not comment on this till the government releases the official data. What is the unique feature, friends? None of you have told me. This is like Incovac. This is India's 100% indigenous vaccine. Completely produced in India. So that is another good thing. Many of you may have taken this vaccine. So I'm sure you'll be able to answer all these questions correctly. Type, dosing, route, site, efficacy. Let's go through it quickly, friends. Dose is same, 0.5 ml each. There should be 2 doses. And what is the gap recommended for Covishield? It is 12 to 16 weeks gap. Intramuscular deltoid. Efficacy of all these vaccines have been reported between 70 to 80%. Last reported 78% for Covishield, which is good enough. And which type of vaccine this is? This is just like Incovac, non-replicating adenoviral vector-based vaccine. This has been developed by Serum Institute of India, Serum Institute, Pune. Okay, all of you are writing correctly, friends. Covishield, Covaxin. Either you have taken Covishield, 90% Indians, 5 to 10% have taken Covaxin. Booster dose should be taken only from Covaxin, Covishield, whichever vaccine you have taken earlier. But now Incovac has been approved as a heterologous booster dose. One more vaccine has been approved as a heterologous booster dose if you have taken Covaxin, Covishield earlier. Now, all these vaccines, all the COVID vaccines in India, temperature requirement cold chain is same, +2 to +8. So, Covaxin, Covishield, Incovac, all require +2 to +8 degrees centigrade only. Okay, friends, very right. This is also known as AZD1222. Thanks for reminding Dr. Rahul. AZD1222. So, which vaccine besides Incovac has been approved as a heterologous booster dose? That is the fourth COVID vaccine of India, Corbevax. Now, Corbevax is which type of vaccine? This is RBD, receptor binding domain proteinaceous subunit vaccine. So it is a proteinaceous vaccine, friends. Please remember, proteinaceous subunit vaccine, dose 0.5 ml, 2 doses, each dose should be 0.5 ml, intramuscular, site again deltoid. Now, if you look at Covaxin, that is for age 15 years and above in India. But if you look at two other vaccines we have discussed, Incovac, Covishield, both these vaccines are for age 18 years and above in India. Corbevax was introduced for adolescents 12 to 14 years of age in the country. This has been made by or developed by Biological E Limited from Hyderabad. And its unique feature I have told you, just like Incovac, it is approved to be used as a heterologous booster dose if you have taken Covaxin or Covishield earlier. Let's move further. So COVID vaccines is going to be asked in this exam. COVID vaccines, COVID disease को अच्छे से पढ़ के जाना है, PSM से भी पढ़ना है, मेडिसिन फार्माकोलॉजी से भी, डॉक्टर गोविंद राय गर्ग से भी आपको जरूर पढ़ना है, और डॉक्टर दिलीप भी आपको मेडिसिन में बताएंगे क्या क्या कोविड के बारे में आपको मिनिमम पता होना चाहिए. आगे चलते हैं. दोस्तों, इस वैक्सीन से मुझे उम्मीद है काफी सालों से आ रही है, इस बार भी आएगी, जेई वैक्सीन. तो जेई वैक्सीन के बारे में फटाफट बता दो. मैं आपके आंसर्स की वेट कर रहा हूं चैट बॉक्स में. आई एम वेटिंग फॉर योर आंसर्स. डॉक्टर प्रमोद, ओपन वाइल पॉलिसी का क्वेश्चन अभी आएगा. कोविड वैक्सीन पे इट इज नॉट एप्लीकेबल. डोंट वरी, मैंने कोई भी क्वेश्चन छोड़ा नहीं आज आपके लिए. आप परेशान हो जाओगे लेकिन क्वेश्चंस पूरे करा के जाऊंगा. जेई किस टाइप की वैक्सीन है? दिस इज अ लाइव अटेन्युएटेड वैक्सीन. लेटेस्ट क्वेश्चन जो आप बताओगे मुझे, व्हाट इज द स्ट्रेन ऑफ दिस वैक्सीन? Dr. Shikha Srivastava has given the first correct answer, SA14-14-2. Diluent, another new question asked recently. What is the diluent? क्या होता है diluent? किससे इसे reconstitute करते हैं? That is phosphate buffer saline. Phosphate buffer saline. Root, तो आपको मैंने बता ही दिया है, ये वैक्सीन एक सबक्यूटेनियस वैक्सीन है. साइड अगर आप बच्चों में दे रहे हो तो यूजुअली हम राइट साइड ऑफ द बॉडी प्रेफर करते हैं. राइट साइड ऑफ द बॉडी वी प्रेफर. और इसका नेशनल इम्यूनाइजेशन शेड्यूल में क्या शेड्यूल है? इसके हम 2 डोजेस देते हैं. पहला डोज देते हैं 9 मंथ्स की एज पे, दूसरा देते हैं 16 टू 24 मंथ्स एज पे. तो जेई लाइव वैक्सीन का फर्स्ट डोज 9 मंथ पे, जेई लाइव वैक्सीन का दूसरा डोज 16 टू 24 मंथ्स की एज पे. डॉक्टर सोयल गर्दे हैज आंसर्ड करेक्टली. फॉस्फेट बफर्ड सलाइन, ये नहीं लिखा हुआ तो आप सलाइन मार्क कर सकते हो, बट फॉस्फेट बफर सलाइन स्पेसिफिकली आपके एग्जाम की चॉइस में लिखा हुआ था, तो इसे हमें मिस नहीं करना है. आगे चलते हैं. ओके दोस्तों, आगे उसी पे जो आप बार बार पूछ रहे हो, ओपन वायल पॉलिसी. एग्जैक्टली दिस क्वेश्चन वाज आस्क्ड. ये FMG में भी आया और बिल्कुल यही क्वेश्चन नीट पीजी में भी आया. सेम क्वेश्चन वाज आस्क्ड इन बोथ द एग्जाम. An ANM receives 2 open vaccine vial. One is MR, one is pentavalent. Which of them can be used for the immunization round? Read the question, mark the answer. Dr. Jishan says A. Dr. Divya says A. Most of you are saying A. So friends, we'll come back to this question. Let us look at open vial policy. Now, Every student knows open vial policy is applicable on which vaccine not applicable. But what we forget most of the times, open vial policy, you can use a vaccine vial opening, after opening, for how much time? Is it 24 hours, 48 hours, 1 week or 4 weeks? It is 4 weeks, up to 28 days. So if vaccine has been maintained in proper cold chain and you are allowed to use it as an open vial, then you can reuse that vial if maintained properly in cold chain up to 28 days. Now you tell me, it is applicable on which vaccines and it is not applicable on which vaccines. So applicable vaccines will include all the T series of vaccines. So DPT, TT, ED. TD I'm mentioning separately because abhi immunization schedule mein this is now included in the immunization schedule, and it will include hepatitis B, OPV, pentavalent. The pentavalent vaccine of Government of India includes Haemophilus influenza B vaccine. This is also applicable on IPV, inactivated polio vaccine. A new additional dose has been added for IPV at 9 months of age recently, but that may not come in your exam. It will take time to appear in the books. Pneumococcal conjugate vaccine also, it is applicable. It is not applicable on which vaccines? Vaccines which are generally lyophilized. So it is not applicable on measles, not applicable on MR. It is not applicable on BCG. It is not applicable on J. Beside this, it is also not applicable on rotavirus vaccine and not applicable on COVID vaccines also. This may be asked in the upcoming examination. So friends, most of you are marking correctly. Dr. Rain is given all the answers correctly. Dr. Gajendra Chauhan has also listed all the correctly. Yes, when we say measles MR, that includes MMR also. Now friends, we come to our question. Now what is the answer? Question is, which vaccine can be used? That means which vaccine open vial policy is applicable? That is pentavalent. What about MR? It is not applicable. So correct answer is choice number A. Discard MR because open vial policy is not applicable. If you have opened the vial, whatever is left after that session, discard the vial. Whereas in pentavalent, you should definitely use, right? So you are absolutely correct. Good to see most of you mark this answer correctly. Now friends, tell me, can you identify this photograph? I'm telling you the name of this gentleman. Name of this gentleman is Manish Kumar. Can you tell me what is the unique feature about this photograph? This is 16th of January 2021. This is first ever dose of COVID vaccination in the country. Yes, video will be available after the session, but trust me friends, those of you who are not watching the video live, you are not going to come back and take the maximum benefit of this session because we keep on piling our time that we will keep on using this PDF, this video. You will not get time. Only few days are left for your exam. Better to complete the course right now. So this is first ever dose of COVID vaccine in India. Mr. Manish Kumar was a health worker in AIIMS, Delhi. Now, when first dose was there, many people who have no idea about public health, they made a declaration, India will take 15 years to immunize the whole population. Can you imagine 15 years? Many said India will never be able to reach each and every village. But thanks to all of you doctors, thanks to all of you health workers, thanks to all the ASHA workers, multi-purpose worker, ground level staff, hospital staff, nursing staff, all the staff, we were able to do it not just successfully, but one of the fastest inoculation rates in the world we have created. So I'm expecting at least one question from this. When did we achieve 100 crore vaccination milestone? When did we achieve 150 crore doses milestone? And when did we achieve 200 crore doses milestone? So let us look at that. 100 crore was achieved on 21st October 2020. So can you see, within a span of 9 months, we were able to do that. Then on 7th of January 2022, we were able to achieve 150 crore doses. And then 17th of July, same year, 2022, we were able to achieve 200 crore doses milestone. Friends, right now, when I check today, 220 crore plus doses have been administered in the country. This is actually a global record at the speed and the coverage in the country. So hats off to all of you friends, hats off to the whole medical fraternity, all doctors, all nurses. Thanks to you, आपके बिना ये पॉसिबल नहीं था. हेल्थ वर्कर्स का भी इसमें बहुत बड़ा रोल है, नर्सिंग स्टाफ का भी बहुत बड़ा रोल है, ग्राउंड लेवल ग्रास रूट लेवल वर्कर, स्टाफ वर्कर्स, आशा मल्टीपर्पज वर्कर का भी बहुत बड़ा रोल है, आंगनवाड़ी वर्कर्स का भी बहुत बड़ा रोल है. थैंक यू सो मच फ्रेंड्स. आगे चलते हैं, लेट्स मूव फॉरवर्ड. Now we move to next topic after epidemiology and vaccines, that is health and disease. Now can you tell me what is the below poverty line criteria calorie wise used in our country India? तो below poverty line का क्या criteria है rural area में, urban area में? This is in kilocalories per day. What is the cut off? क्या है इसकी कट ऑफ? मैं आपके आंसर की वेट कर रहा हूँ. डॉक्टर इनविजिबल ने सबसे पहले बताया है सही जवाब. Dr. Invisible, you are right. Dr. Huitash, okay, all of you are right. Dr. Vaibhav, you are right. Dr. Shikha, I hope आप rural urban को सही से लिख रहे हो. Rural, it is 2400. So if a person is not able to afford 2400 kilocalories a day in rural area, he is a poor person because this is average estimated daily requirement. Urban area, lesser physical activity, lesser requirement, the cutoff is 2100. So don't intermix both. रूरल एरिया में ज्यादा फिजिकल एक्टिविटी है तो ज्यादा रिक्वायरमेंट भी होती है. 2400, 2100, वन ऑफ द पॉपुलर क्वेश्चंस इन द एग्जाम. करंटली इंडियाज पॉपुलेशन 27.5% is living below poverty line. PG exam they ask you MDPI, multi-dimensional poverty index. It is based on that. So roughly 1/4 to 1/3 of Indian population is living below poverty line. आगे चलते, let's move forward. Two different questions. What is the level of prevention? Tell me for first photograph. Tell me for second. In the chat box, I'm waiting for your answer. So one is which level of prevention? Second is which level of prevention? What is one showing in the photograph? This is monitoring of blood pressure. What is shown in the second photograph is a seat belt. Both have been asked multiple times in your examination. Okay, we are getting secondary, primary, but please mark as 1 or 2 which is secondary, which is primary. Both are secondary, both are primary. Okay, Dr. Naira Sheikh, Dr. Vaibhav Dajij has given the first correct answer, friends. All of you are correct, although. See, first says, first photograph is monitoring of blood pressure. By monitoring blood pressure, you can only detect hypertension. So this is secondary level of prevention. What about seat belt? See, risk of accident is there. Problem is head injury and death occur due to head injury. So seat belt and helmet when we use, that is actually primary level specific protection. So secondary diagnosis, primary specific protection for head injury and death of a person or any complication. This is level of prevention. Okay, one of the recent questions of our exam, read the question carefully. Counseling screening is done for TB and HIV positive patient at ICTC Center, Integrated Counseling and Testing Center. This is under National AIDS Control Program. I'm sure you are aware. This is which level of prevention? So just tell me the answer, friends. I'm waiting for your answer. Choice number. Okay, most of the friends are saying B, some are saying C. Dr. Abhishek Mishra says C, Dr. Mayur says B, Dr. Vishal says B, Dr. Ramesh says B. Dr. Nitin says D for Delhi. Okay, friends, there is some confusion. Most of you are saying correct, but we need to understand. See, this question was asked for the first time where two questions were combined in a single question. Let's see. First, they said counseling. when you are counseling a person, why do you counsel a person? Because there is some risk factor present. You are trying to prevent the outcome, like marriage counseling, like a couple is headed for divorce. So we do their counseling, risk factor is present, it's not going good between them, we are trying to prevent the outcome. So this is definitely primary level health promotion. But look at the second part, screening. See, counseling you are doing about how to prevent TB in HIV positive patient. TB is the commonest opportunistic infection of HIV in India. And second is screening. Screening is early detection. So this is secondary diagnosis. So answer to this question is choice number B. See, all of you got the answer right. Give a pat on your back. जिसका आंसर सही है अपनी पीठ थपथपा लो. लेकिन जिसका गलत है दोस्तों, डोंट गेट डिसहार्टेंड, निराश नहीं होना है. एग्जाम में सही मार्क करना है. यहाँ फर्क नहीं पड़ता अगर आपने कोई गलती भी कर दी. इट इज अ लेसन कि एग्जाम में सवाल को बहुत ध्यान से हमें पढ़ना है. तो दिस इज प्राइमरी प्लस सेकेंडरी. आगे चलते हैं. व्हाट इज अ स्यूडो कैरियर, व्हाट इज अ इंडेक्स केस, ये क्वेश्चन था. और आपके एग्जाम में पूछा गया व्हाट इज अ सीरियल इंटरवल. तो मैं आपको ओपन एंडेड क्वेश्चंस दे रहा हूं ताकि आपको वो भी सोचने का मौका मिले. सिर्फ एमसीक्यू देते हैं तो हमारा माइंड थोड़ा उस तरफ चला जाता है, थोड़ा अप्लाई भी करना है माइंड को. तो दोस्तों फटाफट बता दो, स्यूडो कैरियर लेटेस्ट क्वेश्चन जो रिपीट हुआ था कैरियर्स में से, वो स्यूडो कैरियर था. इतने आप इसके आंसर लिख रहे हो तो मैं बता देता हूं. प्राइमोर्डियल लेवल होता है रिस्क फैक्टर को रोकने के लिए. प्राइमरी, after risk factor is present but disease has not yet taken place. Secondary, early part of disease diagnosis. Tertiary, late part of disease when treatment may already be given. Very right, Dr. Kazi, Dr. Guera, Dr. Harshit, Dr. Rishabh, you have given correct answer. Pseudo carrier, don't say it is not a carrier. It is a carrier, but it is a carrier of a virulent organism. Don't worry about this. अगर ऑर्गेनिज्म हमारी बॉडी में आ भी गया तो भी कोई मैनिफेस्टेशन नहीं आएगी. सो दिस वाज वन ऑफ द रीसेंट मोस्ट क्वेश्चंस. इंडेक्स केस तो ऑल ऑफ अस नो. दिस इज फर्स्ट केस कमिंग टू नोटिस ऑफ इन्वेस्टिगेटर. See, primary case is first case of a disease in a community. Secondary case, which occurs after primary case, after getting infection from primary case. Index case, first case coming to notice of investigator or first case getting diagnosed by the health system. And what is serial interval? Interval, it is a interval or a gap between primary case and secondary case. First case and subsequent case, it may be approximately near to incubation period, but could be different also. Dr. Guevara is right. Dr. Ankit Yadav, you are also right. Dr. Reen, Dr. Ujjwal is also right. Dr. Ujjwal, you are going slightly slow. You can drag your screen. If someone of you is not seeing pseudo carrier index serial interval, just drag to the rightmost corner video. We are currently discussing pseudo carrier index case serial interval. Okay, let's move forward. ICD 11, quickly tell me how many volumes, how many chapters, and mental behavioral neurodevelopmental disorders are in which chapter. Now, I am sure all of you know ICD, International Classification of Diseases. This book comes every 10 years. ICD 11 was released in June 2018. But we started using it only after 3 years of that. So many of you have started writing the correct answer. 3 volumes, 26 chapters along with X and B. Mental behavioral neurodevelopmental disorders are in chapter number 6. Beside this, not elsewhere classified, this also you must know, is chapter number 21. And chapter number 26, I feel maybe asked this time. This is for traditional medicine. So just go through it once, move forward. Which type of time distribution this is? Is it an epidemic, seasonal trend, secular trend, or cyclical trend of the disease? I have given you all the 4 choices: epidemic, secular, seasonal, cyclical. Waiting for your answer, friends. Let us see who gives me the first correct answer. Fastest finger first of KBC. Okay, Dr. Kazi says it is a secular trend. Dr. Manish, Dr. Guvera says cyclical trend. Dr. CID also says cyclical trend. Dr. Doxy, cyclical, secular, cyclical. Dr. Invisible says seasonal. Dr. Zain says seasonal. Friends, only 2 of you are saying seasonal. But the thing is, only 2 of you are correct out of the 150 plus answers I have received only till now. Friend, this is a lesson for you also, me also. In the exam, we will not hurry. We will read the image. Let us read the image. First peak comes in year 2000. Next peak comes in 2001, 2002, 2003, 2004. Peak is coming every year. That means it is getting repeated in a particular season. And friends, you have not seen the second biggest clue given in the image. Influenza-like illness. Respiratory disease. It always occurs mostly in winters. So every year there is a peak in November, December. So this is an example of seasonal trend of a disease. I have discussed it detail in all my classes, in all my videos. We cannot go wrong, friends. It is a seasonal distribution of disease. NEET PG aspirants also, please go through these images. These have been asked in your examinations also. Friends, so every year it is occurring. It is a seasonal distribution. Like we have respiratory disease in winters, malaria, dengue in rainy season or immediately after that. Let's move forward. This particular image shows which type of time distribution. I'm waiting for your answer. Okay, meanwhile, I'll start seeing when the peak occurs. First peak, second peak, third peak, fourth, fifth, sixth, seventh, eighth, ninth, 10th. Yes, influenza gives you maximum cyclical trends, but influenza can occur as epidemic also, seasonal also, and it is a secular trend also. A single disease can show multiple type of trends also. I've discussed in the video, friends. Where most of us are marking correctly. This is, yes, first 1830. The second peak occur after a gap of 10 years. Third peak, 10 years, 1850, then 1860. So it is occurring after a gap of every 8 to 10 years. So this is cyclical trend of a disease. Quickly, 3 questions I will revise with you. Measles show a cyclical trend once every 2 to 3 years. Rubella shows a cyclical trend once every 5 to 8 years. And like your friend said, influenza shows maximum cyclical trends because of maximum antigenic variations, drift and shift. Drift is due to point mutation. Let's move further. Okay, friends, identify what is shown in this particular photograph. Now, what I am doing is I am moving to the next topic, screening of disease. Common screening and diagnostic tests are asked in the examination. So we are starting with the first one. Dr. Kazi has given the fastest correct answer. Dr. Piyush Pushp, you are also correct, dear. Dr. Javed Khan, आप भी सही हैं दोस्त. Dr. Elizabeth, okay, आपका नाम बड़ा different रखा आपने. RT-PCR is the correct answer. So friends, this is RT-PCR. डिटेल्स आप पढ़ोगे मेडिसिन और बायोकेमिस्ट्री में. ये तो हम सबने करवाया है, कई बार करवाया है. नेजोफेरेंजियल स्वैब, नेजल स्वैब तो हमने बहुत बार दिया, राइट. बड़ा मजेदार प्रोसीजर होता है, राइट. ओके, तो RT-PCR टेस्ट जिसमें हमने सैंपलिंग को इनएक्टिवेट करके आरएनए एक्सट्रैक्शन की, फिर उसमें रिवर्स ट्रांसक्रिप्टेज यूज किया. ऑफ कोर्स यू नो दी प्रोसीजर. तो आरएनए टू डीएनए और उसके बाद एम्पलीफाई करके उसे हमने डायग्नोसिस के लिए यूज करा. रियल टाइम जो मेथड होता है उसमें आप रियल टाइम जो RT-PCR मेथड होता है उसमें करते करते ही आप टेस्ट का डायग्नोसिस बना सकते हो डिजीज का. तो ये टेस्ट ऑफ चॉइस है, वेरी राइट. करंटली कोविड-19 डिजीज इन दी कंट्री के लिए. तो RT-PCR को थोड़ा डिटेल में पढ़ के जाना. आगे चलते हैं. Identify what is shown in this photograph. Let me make it more clear. Identify the diagnostic test and the disease for which it is used. कौन सा टेस्ट है, किस बीमारी डिजीज के लिए यूज करते हैं. बिल्कुल सही डॉक्टर दिव्यम. कई बार इमेजेस के अंदर आंसर लिखा भी होता है, आपको ही ध्यान से पढ़ना है. पिछली वाली इमेज में लिखा हुआ था. यू आर राइट. यस डॉक्टर कैरोलिन, आई विल यूज mostly English only. At few places, if I speak in Hindi, that is just a repetition of what I have said earlier. Okay, Dr. Kazi says this is HbA1c test. Nahi dost, no, it's not HbA1c test. See, read what is written on the slide. It says blood glucose level on y-axis, time on the x-axis. None of you is telling me the name of the test. Disease, you are right, it is diabetes. What is the name of the test, friends? No, it is not line diagram. It is a diagnostic test. Don't mix statistics in this, friends, please. Dr. Saumava Mandal has given the correct answer. This is oral glucose tolerance test, one of the diagnostic test of diabetes. There was a question in your exam. What is the cutoff in oral glucose tolerance test for the diagnosis of diabetes? We take 2-hour value at 120 minutes and we take venous plasma glucose. What is the cutoff level? It is 200. So any person who is having venous plasma glucose more than 200 milligram per deciliter at end of 2 hours will be diagnosed as diabetic. Others will be diagnosed as non-diabetic. I'm just making it slightly simplified. So you just have to remember oral glucose tolerance test, venous plasma glucose level at 2 hours, more than 200, diagnosis of diabetes. What are the other two tests for diagnosis of diabetes in the country? If fasting blood sugar is more than, yes, you are right, 126. And third, if glycated glycosylated hemoglobin HbA1c is more than, what is the answer? Yes, you are right, friends. Sab sahi hai, 6.5%. You are absolutely right. Friends, many of you are writing different values. Please remember, globally, these are same. Venous plasma glucose, only 2-hour values used for diagnosis of diabetes. Cutoff is 200, not 180, 200 in the world. Fasting blood sugar, not 116, 126, HbA1c, 6.5. Quickly tell me, what is the sensitivity specificity of this test? Again, you have to calculate it mentally. I'll write the formula in front of you. Meanwhile, this is your A, true positive. This is your B. This is your C. And this is your D. A is true positive. D for Delhi is true negative. B is false positive. C is false negative. Now quickly tell me, Dr. Anurag Tiwari, amazing dear. Dr. Anurag Tiwari has calculated both sensitivity, specificity fastest. Dr. Vinay Yadav also. All of you are correct. But many students have calculated, like Dr. Dhruv Aghera also has calculated both correctly. I'm very happy. Sensitivity is A upon A plus C into 100. So this is 95 upon 100 into 100. 95%. See friends, be smart. If your examiner is not giving you a pen and paper, definitely he will give you some values which you can calculate mentally. So it will be very simple like this, 95.5, 99.1. Now specificity is calculated as D upon B plus D into 100, 99 upon 100 into 100. So this is 99%. Friends, those of you who got this answer correct deserve an applause. But those of you who got it wrong, friends, please go through all the formula from the PSM subject. What? Maximum 25 formula are there. Nowadays, calculations are asked less, but they do come. Mostly they ask you either numerator, denominator, or the total formula. So you'll have to go through the formulae once. Formulae are in chapter of screening, demography, biostatistics, and few formulae here and there. You have to do them. Epidemiology, we have already discussed, relative risk and odds ratio. Yes, so sensitivity 95%, specificity 99%. Sensitivity is also known as most useful property. So usefulness of a screening test. Let's move further. Now friends, after doing this, sensitivity, specificity, I am moving to now communicable, non-communicable disease section. Identify This is an image I have taken exactly from the question which appeared in NEET PG as well as FMG exam. Same question was there. Identify the condition, make a diagnosis. Just write the answer in the comment box. I'll read it. Okay. Most of you are writing the disease correctly, but what is this condition? Yes, disease is diphtheria. What is this condition known as? None of you has written the condition. That was my first question. Okay, thank you, Dr. Guevara. You have again given the first correct answer. Most of you are correct. This is bull neck. And disease is, you are right, diphtheria. Can you tell me what is the pathognomic clinical feature of diphtheria? Pathognomic clinical feature of diphtheria is not pseudomembrane. If pseudomembrane was the pathognomic clinical feature, I will show only pseudomembrane. So please remember, bull neck is the pathognomic clinical feature of diphtheria. What is the pathognomic clinical feature of rabies? Hydrophobia. What is the pathognomic clinical feature of measles? Yes, that is Koplik spots. Many of you are writing pseudomembrane. No, friends, pseudomembrane is there in diphtheria, but pseudomembrane is not the pathognomic clinical feature. Bull neck is there, therefore bull neck is shown in the photograph. So diphtheria, Corynebacterium diphtheriae. Why this bull neck occurs? It occurs due to two reasons. One is cervical lymphadenopathy is there, and second, there is mucosal swelling. So cervical lymphadenopathy plus mucosal swelling. Second question is more easy. You were asked to identify this organism. So quickly identify. This is, yes, all of you are right. This is HIV virus. See, there are so many clues. GP41, GP120, reverse transcriptase, P24. So many clues are there, friends, and the image is unique. You will never forget. So this is HIV, one of the easy questions. 50 to 60% questions will be very easy in FMG as well as NEET PG. 20 to 30% moderate. 5 to 10% you will feel are of the higher difficulty level. Nothing to worry. You will score and clear the exam easily. Tell me the definition of paucibacillary leprosy, multibacillary leprosy. Paucibacillary, multibacillary. Paucibacillary is when number of skin lesions is 1 till 5. Multibacillary when it is more than 5. Paucibacillary, 0 to 1 nerve. Nerve may be involved, may not be involved. But multibacillary, minimum 1 nerve is involved. Yes, many of you are writing correctly. Dr. Javed Khan, Dr. Toxic naam acha nahi hai, but Dr. Khalid, not less than 4, less than 5, up to 5 rather. Right? Paucibacillary. Friends, please remember, India has not yet adopted the uniform MDT guidelines of WHO. Paucibacillary, we still use 2 drugs, Dapsone, rifampicin for 6 months. For multibacillary, we still use in India till today 3 drugs, Dapsone, rifampicin and clofazimine for 12 months. Follow-up in paucibacillary is for 1 year. So 1 year follow-up. 2 years follow-up. In multibacillary, it is a 5-year follow-up. So 2-year follow-up in pauci, 5-year follow-up in multibacillary. We move to the next question. Tell me the definition of MDR-TB, XDR-TB. Also, please first tell me what is X, because many students marked this answer wrongly when it was asked. What is X in XDR-TB? MDR-TB, multi-drug resistant TB, is resistance to isoniazid and rifampicin. 2 most important drugs if both are resistant at the same time in same person's body. XDR, X is extensive drug resistance, extensively drug resistant, extremely drug resistant. I'll confuse you because choices were confusing. Extensive, extensively, extreme, extremely. Which type of drug resistant TB is XDR? What is X? Okay, Dr. Kishore Kumar only has given the correct answer till now. It is extensively drug-resistant TB. And what does it include? It includes 3 resistances. One is MDR TB is included. So resistance to isoniazid rifampicin plus any one fluoroquinolone, which is a second line drug, plus any one second line injectable. What are the 3 second line injectable? Just revise in your mind. It is kanamycin, amikacin, capreomycin. Any one of these will make it definitely a XTR TB case. MDR XTR TB treatment is available very high quality in our country. Let's move forward. Quickly make a list. What are the diagnostic tests of COVID-19 in our country? Kala-Azar in our country. What is the diagnostic test for dengue in our country and malaria in our country? Mark the single best answer, but if you know multiple answers, that should also come in your mind. This we have already discussed COVID-19. RT-PCR is the single best answer, but rapid antigen test is also used in the country. I am circling the questions asked in your exam. Kala-Azar, when we look, serological diagnosis is based on which antigen? This was asked. NEET PG also, FMG also, RK39 antigen. Otherwise, DAT and ELISA test you will read in microbiology are also used. Serological diagnosis of dengue is based on which antigen? NS1 antigen. Many times it has been asked. Unique advantage of this test comes positive in first week of illness, within first 3 days of illness, even sometimes on the first day of illness. So this is a very useful test. Beside this, tourniquet test may be used as a clinical test if number of petechial spots are more than or equal to 10. Dengue fever diagnosis, more than or equal to 20 per square inch of skin. In tourniquet test, dengue hemorrhagic fever diagnosis is made. Malaria, we use peripheral blood smear, but rapid diagnostic kit is also present. When we look at malaria, the peripheral blood smear microscopy is done. But when we look at antigen, which is used for serological diagnosis in dipstick test antigen has been asked, histidine-rich protein type 2 of Plasmodium falciparum antigen. So friends, I hope you knew answer to all the questions. What I am trying to do, I am trying to collate बहुत सारे questions को इकट्ठे करने की कोशिश कर रहा हूं ताकि आपका सारा रिवीजन आज की आज ही हो जाए. Let's move further. Serum markers of hepatitis B. Every exam has this question. हर exam में question आता है. तो quickly tell me the answer to these 4 questions. What is Australia antigen? Which serum marker of hepatitis B is known as epidemiological marker? Which serum marker is used for acute hepatitis B? And in vaccinated person, which serum marker I am likely to locate? So friends, फटाफट बता दो मुझे इसका आंसर. मैं आपके आंसर का इंतजार कर रहा हूं. ऑस्ट्रेलिया एंटीजन है HBs AG. Hepatitis B surface antigen. This is also the first antigen to appear in the body. ज्यादातर आपने, all of you have marked this answer correct, most of you. Epidemiological marker is also same, Australia antigen, surface antigen. Acute hepatitis B, what is the marker we use? Yes, we use antibody to core antigen, anti-HBC and IgM. IgG will tell you chronic hepatitis B, anti-HBC, IgM, and in vaccinated person we will find anti-HBs. One more question you can tell me. If I ask you marker of infectivity, active viral replication, then that is hepatitis B envelope antigen, E antigen. So active viral replication is taking place. So that is definitely marker of infectivity. Just keep this slide in your mind. Whatever question comes, you will be able to mark this answer correctly. Let's move further. Mark this answer. One of the recent questions repeated many times in national board examination. Recent transmission of malaria can be calculated from annual parasitic incidence, infant parasite rate, slide positivity rate, or spleen rate. Tell me the answer. Also remember, I is incidence. When this question was asked, many students marked index. It is incidence, new cases. Okay, very right. Recent transmission. It has to be infant parasite rate. Last 12 months, if you find infant's body, then definitely recent transmission. Best measure of malaria control, also known as most sophisticated measure, is annual parasitic incidence. Spleen rate tells you endemicity. And how do you find out operational efficiency of malaria control program? That is by annual blood examination rate. So just revising 4 with you, आपके साथ ये 4 important revise कर रहा हूँ. Annual parasitic incidence, best measure of malaria control, most sophisticated measure of malaria control. Infant parasite rate, recent transmission of malaria. Annual blood examination rate, operational efficiency of malaria. And spleen rate is endemicity. Life cycles are shown as images. Identify the disease shown in this photograph. I am giving you complete 30 seconds to mark this answer. Let us see who can mark this answer fastest. So many clues have been given in the question. Read the image. I am waiting for the first correct answer. This is which disease? Dr. Radical, absolutely correct. Dr. Invisible, Dr. Dharamveer Prasad is absolutely correct. Dr. Mercy is correct. Most of you are correct. Few of you are writing this as malaria. No, friends, this is not malaria. No, this is not yellow fever. Many of you are writing wrongly also. Let us look what is shown in the photograph. Water birds. They are the actual host of which disease? Yes, answer to this question is Japanese encephalitis. Look at its vector, Culex. That is which Culex? Culex tritineorhynchus. Remember this word completely. And who is the amplifying host of this disease? Yes, it is pigs. It is in fact written also. Pig are the amplifier host. Horses are the mosquito attractants. I have discussed these diseases in detail in all my classes and videos. And humans are the accidental dead end host. Right, so we have already discussed the vaccine. Phosphate buffer saline is the diluent. Subcutaneous vaccine SA 14-14-2. So this is Japanese encephalitis. Let us move forward. One of the recent easy questions. Pregnant female scratched by a street dog. What is the treatment given? Only local treatment. Rabies vaccine plus local treatment. Local wound treatment plus vaccine plus bed rest. Immunoglobulin plus vaccine plus local wound treatment. Okay, friends, I must tell you, throughout the year, I get at least 1 to 2 calls daily from my former students throughout the India who are medical officers doing MD completed or they are practicing only on dog bites. So you can imagine it is such a big disease that we have a national rabies prophylaxis program in the country. You should know every possible detail. Bites are divided into 3 classes, 1, 2, and 3. Even today, when we look at class 1, it includes licks on unbroken skin. So treatment requires nothing special, only wash it properly with soap and water if it is a lick on a unbroken skin. But if there is a scratch without oozing of blood, that falls into category 2. You have to use local wound treatment. Plenty of soap and water should be used. Washing should be done for 10 to 20 minutes. And vaccine should be given. So here vaccine will be given. But if there is oozing of blood, if there are multiple transdermal bites, that make it category 3, and here vaccine plus immunoglobulin and of course local wound treatment will be there. Now here they say pregnancy, it will not make a difference. They are saying the female has been scratched. So it is rabies vaccine plus local treatment. B is the correct answer. Most of you have marked this answer wrongly. So I'll again repeat. Licks on unbroken skin, category 1. Only local wound treatment, soap and running water for 10 to 20 minutes. If there is a scratch without oozing of blood, category 2, local treatment, local wound treatment plus rabies vaccine. If there is oozing of blood or multiple transdermal bites, then local wound treatment plus vaccine plus immunoglobulin also has to be given in category 3. So friends, don't mark this answer wrongly. Yes, Dr. Piyush, Dr. Shashi, Dr. Seni, you are right, but many students mark this wrongly. So those who have marked correctly, good, but friends, others, we have to improve it. So this is rabies. What is the content composition of this particular ORS? So we are using low osmolarity ORS in the world. So you have to tell me sodium chloride is how much, potassium chloride is how much, sodium citrate is how much, glucose is how much, and what is the total weight of a ORS packet. When we dissolve it in 1 liter of water, we can use it up to 24 hours. So what is the osmolar concentration of sodium ion, potassium, chloride, citrate, and glucose? And what is the total osmolar concentration of complete ORS, one packet? Friends, I'm asking you this in detail because it is asked in detail. Sodium chloride is 2.6 grams, potassium chloride 1.5, sodium citrate 2.9 grams is there, and glucose is 13.5. Total 20.5 grams is the weight of a single ORS packet. Dissolve it in 1 liter of water. It will generate sodium ions 75 millimoles per liter, potassium ions 20, chloride ions 65, citrate 10, and glucose is 75. 245 millimoles per liter is the total osmolar concentration of one ORS packet. Please remember, friends, this is also known as medical discovery of last century. Rhizomal, rehydration solution for malnourished, sodium is half, potassium is doubled. And in super ORS, we use, beside glucose, some other as a stabilizing material. See here, glucose is used because sodium and glucose have a co-transport or same transport mechanism. So we substitute it with some other amino acid. Let's move forward. Okay, friends, continuing still with communicable, non-communicable diseases. No need to write in the chat box for this because I'm asking many questions at a single place. You just keep on revising with me. What is the incubation period of COVID disease? COVID questions will definitely come in the exam. So just keep on revising with me. This is 2 to 14 days. But if they ask you an average, it is 5.1 days according to the global data. I'm only asking those questions which have been asked in FMG and NEET PG papers in last 5 years. Influenza, 1 to 3 days or 18 to 72 hours. Diphtheria, 2 to 6 days. Cholera, 1 to 2 days. Just keep on checking how many of you are able to mark correct out of them. Monkeypox is a new disease, may be asked 5 to 21 days. Yellow fever is just like diphtheria, 2 to 6 days. What is the quarantine period of yellow fever? Quarantine period of any disease is its maximum incubation period. So 6 days is its quarantine period. Hepatitis A and B. Hepatitis A, 2 to 6 weeks, 15 to 45 days. Hepatitis B, 6 weeks to 6 months, 45 to 180 days. Measles, one of the most popular incubation periods, 10 to 14 days. But single answer if they ask you, 10 days. First symptom appears on 10 days. HIV ranges from months to years. In India, median incubation period is 10 years. Ebola virus disease, 2 to 21 days. Friends, this you should definitely know. Maybe if you want, okay, let me add one more to this. Mucormycosis. Dr. Govind sir has already told you mucormycosis. The drug of choice is LAM, liposomal amphotericin B. Its incubation period, some studies have a difference, but they say mainly around 7 to 10 days. If out of these 11, you were able to mark 9 or 10 correctly, then friends, it is good. Otherwise, you will have to go through incubation periods of at least these diseases. There is no shortcut here. Okay, let me give you a relaxing question now because this was slightly more intensive. Yes, drug of choice. Okay, Antenatal visits, minimum India is 4, WHO is 8, although that will come later. Identify the disease whose geographical distribution is shown in the map of the country. I want the name of the disease and the drug of choice. Disease, drug of choice. I am waiting for your answer. Okay, Dr. Gaurav has given the first answer. Dr. Vikrant says it is JE. Dr. Piyush says it is Kala-Azar. Dr. Mukesh says JE. Kala-Azar, JE. Kala-Azar, JE. There is a confusion between Kala-Azar and JE. Friends, Japanese encephalitis is present in 70 to 80% of our country. Therefore, its vaccine is in the immunization schedule also. This disease is only found, you can see in the map, only restricted to 5 or 6 states. And which states are these? UP, Bihar, Jharkhand, and West Bengal as the major states. So this is definitely Kala-Azar. Visceral leishmaniasis caused by Leishmania donovani. What is the vector? Sandfly. And what is the drug of choice? Not amphotericin B, liposomal amphotericin B. Second line is of choice in India is a combination of miltefosine and perimomycin in the program. Okay. Identify the disease which is shown in the photograph. This is a 1.5-year-old picture, but you will be able to identify which disease is shown in this photograph. I'm just waiting for your answer. Okay, Dr. Qazi Saifuddin has given the first correct answer, friends. This is very right. COVID-19. It is present throughout the country, but 2 states which have consistently given us the maximum number of cases are Maharashtra and Kerala. In fact, first case was reported from Kerala only in the new year, that is in the January of year 2020. Globally, Wuhan from China was the place from which first case originated. I have been to Wuhan 4 times to teach students, but I never knew that it will turn out to be the origin of such a dangerous disease on this planet. Okay, friends, let's move further. Identify the disease shown in the photograph. You can see those states which are in darker color, they have a prevalence higher than the national average. That is the black or the gray color. But the yellow or the orange color, you can say, is lower than the national average. So which disease? Okay, Dr. SM is dog, Dr. Qazi Ranga, Dr. Elizabeth. Most of you are correct, friends. Very happy to see this answer. Wonderful, bahut achhe. HIV. HIV has now got not 6, 7 high prevalence states. So Maharashtra, Karnataka, Andhra, Tamil Nadu, Mizoram, Manipur, Nagaland. 7 high prevalence states. Gujarat, Goa, Pondicherry are moderate prevalence, all other are low prevalence in the country. Overall prevalence in the country is 0.22%. HIV first case in the world was found in 1981, but HIV virus was discovered in the year 1983, HIV-1. HIV-2 was discovered in 1986. So you have to remember this. HIV virus, not case, HIV virus was discovered in the year 1983. And friends, India is having which subtype of HIV? It is subtype 1C as the common type of HIV in the country. Let's move further. What is urban heart? It's obviously the full form is given in front of you. Urban health heart is actually an abbreviation. Urban Health Equity Assessment and Response Tool. This particular is a tool which is used to plan an action. You can make an action plan using this tool by WHO, which is based on, the word you have to remember is inequities in health. This was the question asked in the exam. So just remember Urban Heart, where HEART is Health Equity Assessment and Response Tool. HEART is in capital. This is a tool given by WHO to plan action on inequities in health. So health is not distributed equity or throughout the world. So there are some inequities that is addressed and that is used to plan further action in the programs or the policies through using this Urban Heart tool. So I've seen none of you answered this question. So that means you have to remember this. This is not a hypothetical or dummy question. This was actually asked in the FMGE exam. Urban Heart, inequities in health. Just remember that. Okay, friends, now we move to the health programs of our country. Identify dots. Dots, directly observed treatment. What is S? Short course of chemotherapy. Now, what is the name of the program currently? The program currently is National TB Elimination Program, where our main goal is to eliminate TB in the country by which year? Tell me the year. I'm waiting for your answer. Yes, dots, everyone has marked correctly. No, Dr. Nitin, this is not Nikshay. Nikshay is actually an ICT enabled surveillance system. It is a software. Its logo writes the word Nikshay. That is an ICT enabled surveillance system. Yes, TB elimination, earlier the target was 2030 from the country, but our program was going so good that we preponed the target by 5 years. Now we have to eliminate TB from our country by 2025. This program was launched on 1st January 2020, after which COVID came in the country. Let's move further. Identify the health program, first question, and tell me which 6 diseases are covered in this program. Yes, you can see vector, 45 degrees, so it is Anopheles. So program is National Vector-Borne Disease Control Program. And just think, which are the 6 commonest vector-borne diseases of India? These are malaria, number 1. Number 2 is dengue. Then comes Japanese encephalitis, Kala Azar, chikungunya fever, and filariasis. So 6 vector-borne diseases are covered by this particular program. Identify the health program. We have discussed the details of this program already. So first question is the program. Second question, what is the elimination level for this disease? This is asked in your exam multiple times, both FMG and NEET. India achieved this level of elimination in December 2005. Okay, so we have started getting the correct answer. This is National Leprosy Eradication Program. They use the word eradication, technically slightly wrong, but okay. National Leprosy Eradication Program of India. And what is the elimination level? I'm waiting for this particular answer. No one has answered yet. What is the elimination level for leprosy? Yes, less than 1 case in 10,000 population. Very right. Those who have answered correctly, very good students. Others also, you have to remember this. Let's move further. Identify, what are these? These are blister packs which are used for treatment in leprosy. Leprosy treatment is MDT, multi-drug therapy. So now you will have to remember color wise. When you look at this green colored pack, this is for possibacillary treatment of adult. So this will be for 6 months. I've told you that WHO uniform MDT treatment has not yet been adopted in the country. Lower one, the pink or the red one, is multibacillary leprosy treatment of adult. This is for 12 months. On the right side, blue one, this is possibacillary leprosy children, pediatric treatment, again for 6 months. Whereas the yellow blister pack, is multibacillary leprosy for children given for a duration of 12 months. Friends, please make a photographic impression of this in your mind. If you are using a mobile or a desktop to go through this session, you can take a screenshot. I'll wait for 10 seconds, but you have to remember the blister packs color wise, duration wise, which group and which category correctly for multi-drug therapy under National Leprosy Elimination Program, rather National Leprosy Eradication Program of our country. Quickly identify. One is red color, one is pink color. Red ribbon, pink ribbon. What is this? Very right. This is National AIDS Control Program. NACO also uses it. Inverted red ribbon actually is a symbol of HIV/AIDS. And inverted pink ribbon, breast cancer awareness symbol. I must tell you, breast cancer is currently most common cancer of female population, most common cancer of total population of India also. This is National Program for Control of Blindness and Visual Impairment. I'm just asking you some questions, just answer them. What is the definition of blindness in this program? What is the prevalence of blindness in this program? What has been found to be the most common cause of blindness in this program? Three very popular questions. Waiting for your answer. Now in this program, visual impairment has been added. So what is visual impairment? What is the prevalence? And what is the most common cause? Okay, all of you are answering correctly. Blindness is just the WHO definition in Indian program also now less than 3/16, better eye, best possible correction. Prevalence of blindness in the country now is 0.36%. Most common cause of blindness in India is cataract, 62%, followed by refractive error, 19.7%. Visual impairment is less than 6/18 in better eye with best possible correction. Prevalence is 2.55%. Again, cataract is the most common cause of visual impairment in the country. So focus minimum on upper three questions I have told you in this NP-CBVI health program. Friends, now we look at two new health programs which have been asked in the exam recently. First, you tell me, which is this program, PMJ, Pradhan Mantri Jan Arogya Yojana. So which program am I talking of? PMJ, Pradhan Mantri Jan Arogya Yojana, quickly answer. Yes, this is Ayushman Bharat program. So quickly tell me, one of the popular questions asked in FMG as well as NEET PG recently. Under Ayushman Bharat, how much money can a family get per year as insurance? This is mainly given for secondary and tertiary level hospitalization. This is for below poverty line families in the country. And those institutes can get empaneled who have beds more than 10. Minimum you should know. So what is the answer? Absolutely right. 5 lakh. This is per family, not per person. Per family per year. Let's highlight this. Family gets rupees 5 lakh for secondary, tertiary hospitalization, totally free by the government of India for below poverty line families, totally cashless, paperless schemes. All government hospital institutions are a part of this. Private facilities can become a part if they have minimum 10 beds for admission of patients in their facility. Not 15 lakh, Dr. Zaid bin Tariq, it is 5 lakh, you have to remember. 5 lakh per family per year. This is the second important program, Anemia Mukt Bharat, earlier known as National Iron Plus Initiative. Now, before we go ahead, everyone forgets, what is the goal of Anemia Mukt Bharat program? Goal is to reduce prevalence of anemia by 3% per year. And this is from 2018 to 22. So for 5 years, we had to reduce 3% prevalence every year. It has got 6 beneficiary groups. Their iron folic acid supplementation is asked. So friends, this you have to tell me. Sorry. What is the iron folic acid supplementation? This has been asked in your exam. 6 to 59 month child. You have been asked for adult. You have been asked for pregnant female also. But let's look at all the 6. Iron folic acid for 6 to 59 months. Let's say less than 5 year of child. Iron supplementation in milligram is 20 and folic acid is 100 microgram. 5 to 9-year-old child, it is 45 milligram iron, 400 microgram folic acid. For all the other groups, it is 60 milligram elemental iron and 500 microgram folic acid. You have to remember this, friends. Take a screenshot. You have to remember this. 100% question will come from Anemia Mukt Bharat. There should be no mistake in any group. Now let us look at frequency. This is bi-weekly. In 6 to 59-month-old child, then it is weekly. Here also weekly. Even in reproductive 20 to 49 non-pregnant, non-lactating women, it is weekly. But once it becomes pregnancy lactating, it becomes daily basis. Given for 180 days in pregnancy, 180 days in lactation. So this you have to remember. Take a screenshot right now. So friends, keep your balance right. Cerebellum is required. Let's move further. What is Lakshay? This is the logo of Lakshay. Can anyone tell me what is Lakshay? I'll wait for your answer. It will give rest to my throat also for a minute. What is Lakshay? It is actually an abbreviation. LA. Then there is a Q. Very right, very right. Wonderful, Dr. GRV, Dr. Invisible, Dr. Rain, Dr. Himani Solanki. I'm very happy. This is labor room quality. So focus is on quality during the delivery, the antenatal care, the intranatal care rather, that the quality we are giving, it's improvement initiative. So from this, they have picked these words and made this initiative known as Lakshay. So Lakshay is the initiative for labor room quality improvement. Let's move further. Okay, friends, tell me the important values. Sex ratio, child sex ratio, literacy rate, growth rate annual, crude birth rate, crude death rate. You have to tell me first 4 according to the latest census. The good thing is 2021 census could not be carried out due to COVID. So it is still according to 2011 census. And crude birth rate, death rate. This is according to the latest sample registration system of 2020. Report was released in 2022. So most of you are marking correct values. I'll go through it quickly. Sex ratio of India is 943 females per 1,000 males. Highest in Kerala, lowest in, not Haryana, lowest is in Daman and Diu. Child sex ratio, 919 female children 0 to 6 year per 1,000 male children 0 to 6 year. This is highest in Mizoram, lowest in Haryana. Literacy rate of our country is 74%, 82% in male, 65% in female, highest in Kerala, lowest in Bihar. Growth rate annual was found to be 1.64% in the census of India. India is in very rapid growth phase. 35 to 47 year is the population doubling time of our country. Crude birth rate, death rate, latest values you should know. Crude birth rate is 19.5 per 1,000 mid-year population. Crude death rate is 6 per 1,000 mid-year population. So I hope all of you remember these important. I'm not telling you all the 20-30 values. These 5 are asked repeatedly in your exam. Similarly, tell me the latest values of these MCH indicators. If you are connected to the social media channels of Cerebellum or even me separately together, please subscribe to all those social media channels of Cerebellum Academy also and mine also. Facebook, YouTube, Instagram, Telegram. whenever there is an update, like when these values were revised, I quickly posted an update. So all the educators, all the faculty of Cerebellum Academy will keep you updated. Let's see how many of us remember these values correctly. Infant mortality rate is 28 per 1,000 live births. Most common cause is low birth weight, prematurity, single answer prematurity. MMR of India is now 97 per 1 lakh live births. Most common cause is postpartum hemorrhage. Under 5 mortality rate is now 32 per 1,000 live births. Most common cause low birth weight, prematurity. Neonatal mortality rate is now 20 per 1,000 live births. Again, low birth weight, prematurity. Perinatal mortality rate, again low birth weight, prematurity. Most common cause 18 per 1,000 live births. SBR, still birth rate, we have not yet got the latest value. So it is, we'll take the older value of 21. Now friends, all of them are mortality indicators, and all of them, the denominator is live births. Infant mortality rate is the best indicator of health status of a country overall. Under 5 mortality rate, social development. Perinatal mortality rate, combined indicator best for maternal and newborn care. Okay, Dr. Mohammed is asking face-to-face classes कब open हो रही है? दोस्तों, face-to-face classes, COVID always put a check on that. Recently, very rightly, right now in the country, COVID wave is going on, even swine flu wave is going on in the north and central India. So I believe live classes will start after March. After the NEET PG is there, Cerebellum will also get launched online. So at that time, I think live classes will also start at the time, maybe around April or May, keeping your further examination dates in the mind. Okay, Dr. Muninder Singh is right. All of them have 1,000 as the multiplier, except MMR, where 1 lakh is the multiplier. Good. Let us move forward. Identify the diagram and whether it is for a developing or a developed country. Meanwhile, I'll tell you the shape. So 2 questions. What is this diagram known as? And is it a developing country or a developed country? सर सेरिबेलम के सारे कॉम्प्रिहेंसिव वीडियोस कब आएंगे? दोस्तों, सेरिबेलम की ऐप लॉन्च होगी नीट पीजी के बाद, तब आपको सारे वीडियोस मिलेंगे. Yes, this is developing country. And this diagram is known as population pyramid, also known as age and sex pyramid. Why this is a developing country? Because it is an upright triangle having a broad base. Broad base, why? Because we have high fertility, maximum children are there, 30% children, and we have a narrow top. Right? So upright triangle, broad base, narrow top, developing country. Spindle shape with bulge in middle is developed country. Let's move further. Quickly tell me 2 questions from demographic cycle. Both crude birth rate, crude death rate are declining. Which phase? This is stage 3, also known as late expanding. India is in late expanding stage. And when death rate becomes higher, this is stage 5, declining. There was a question recently. European Union, many countries are in the declining phase now. France, Germany, even the belt of Russia, the population is declining year by year. So this you have to remember. After demography, we move to the next topic, that is family planning and contraception. So let's look at that. First, identify what contraceptive is shown and tell me the dose. So identify the contraceptive, tell me the dose. Friends, I'm waiting for your answer. In fact, it is written, it is Antra. So this is which contraceptive, Antra? Yes, this is DMPA, dipomedroxyprogesterone acetate, and dose you have to tell me now. This is intramuscular injectable hormonal contraceptive, depot formulation. So what is the dose? Yes, 150 milligram intramuscular injection every 3 months. Now on the right side of your screen, 2 intrauterine devices are there. Both are now available in RCH program. Tell me their names and tell me their protective duration. I'm asking a very commonly asked question. Identify the two IUDs. Tell me their names and tell me their protective duration. Friends, I'm waiting for your answer. Still waiting. बताओ दोस्तों, एग्जाम ऐसे तो 3 घंटे तक आप या जितने भी ड्यूरेशन का आपका एग्जाम है ऐसे तो सडनली क्वेश्चन आते रहेंगे. ओके, डॉक्टर पीयूष हैज गिवन द फर्स्ट करेक्ट आंसर. डॉक्टर सार्थक हैज गिवन द. ओके, ऑल ऑफ यू आर सेइंग, मेनी ऑफ यू आर सेइंग कॉपर टी, बट दोस्तों दोनों ही कॉपर टी है, तो डिफरेंस क्या है? नाउ देयर आर टू कॉपर टीज इन द प्रोग्राम. फर्स्ट इज कॉपर टी 380A, highest shelf life 10 years. And now in the program, second copper T has been put, that is copper T. It seems copper T 375, which has a shelf life of 5 years. So in the program, of course, copper T 380A is the most commonly used IUD in the world and India. Don't use the word Mirena because Mirena word we don't use in Indian program. Copper T 388 10 years, copper T 375 5 years. Two IUD in the program. Yes, multi-load is also the name of copper T 375. You are absolutely right, Dr. Arif Sultan. Let's move further. What is the content composition? How much ethinyl estradiol, that is estrogen? How much progesterone, levonorgestrel? This is the question which is asked in Mala and Maladi combined OCP. Also, you must tell me today, this is a type of vaginal sponge. Two recent questions. One, what is the chemical contained in this? And number two, what is the Pearl index, failure rate? Okay, friends, let's try to cover even more questions. So tell me the answer. Okay, Dr. Nitin has started with the first correct answer. Dr. House MD, friend, you have given the best correct answer. Ethinyl estradiol is 30 microgram or 0.03 milligram. Levonorgestrel is 150 microgram or 0.15 milligram. So Maladi also, Malan also, last 7 tablets are iron, 60 milligram ferrous fumarate. Vaginal sponge, which is a polyurethane sponge, it contains 1000 milligram of spermicide non-oxynol 9. Rupture of acrosomal cap it does, and its Pearl index is 9 to 20 per 100 women years. Friends, after contraception, we move to the next topic, environment. Identify the instrument. What is it used to measure? First two questions. Instrument, and what is it used to measure? Instrument is fluoroscope. And what do we measure by fluoroscope? It is free or residual chlorine level. These two have been asked recently. Now, 3 older questions of your exam. What is the free residual chlorine level in drinking water? What is the recommended residual chlorine level in swimming pools of India? And what if I want to kill cyclops in drinking water? So I'm combining multiple questions in a single slide so that it helps you revise the whole course. Can you remember these 3 levels? For all these levels, you can measure them in milligram per liter or ppm. All 3 have contact period of 1 hour. Yes, you have started marking correct answer. Drinking water should be minimum 0.5 milligram per liter or ppm. Swimming pool should be minimum 1. To kill cyclops should be minimum 2. So these 3 values you have to remember. Let's move further. Identify the instrument and also tell me what are they used for. These are 2 different questions, but I have put on the same slide. Identify the instrument. Also tell me what are they used for. Red bulb at the end. Upper instrument is Carta thermometer. And what is it used for? Can I say cooling power of air? No, that is an older answer. Now it is used for low air velocity. Yes, friends, most of you have marked this answer correctly, barring 1 or 2. And second instrument is sling psychrometer. वो जैपनीज फैन होता है ना, जैसे ऐसे ऐसे घुमाते हैं, बिल्कुल sling psychrometer is also rotated like this. What is it used to measure? This is for air humidity, moisture or water content of air. Now friends, we are coming to a question or a topic which will definitely come because it has been coming since last 2 years in your examination. That is this National Air Quality Index, NAQI. Air quality monitoring is the responsibility of, older question, Central Pollution Control Board. Air quality is called as good if it lies between 0 to 50. It is satisfactory if it becomes 51 till 100. Air quality is moderate, 101 to 200. Poor, 201 to 300. Then it is very poor if it is 301 to 400. And severe if it is 401 to 500. Today, Delhi had an air quality of around 370, 370. So that is very poor. Today, I'm talking of today only. Friends, please remember how question came. They gave you 21st November, 22nd, 23rd, 24th, different air quality index values on different days. Then they asked you like this. On 23rd November, what was the air quality category? So read the number. If it is 470, it is severe air quality. If it is 370 like today, very poor air quality. This has been already asked in the exam. What they have not asked, this NAQI, National Air Quality Index, is based on which parameters? So make a list. Particulate matter 2.5, particulate matter 10. What is the best indicator of air pollution? Sulfur dioxide. Otherwise, nitrogen dioxide, carbon monoxide, ammonia is also used. Also, we are using ozone and lead for calculation. So these are 8 parameters used in NAQI, National Air Quality Index in the country. Now, friends, besides water, air, instruments we have discussed, very important question comes where you are asked to identify the important vector. So I am showing 3 vectors. Quickly mark which vector are these. Also mark the identifying feature. Also you have to mark what is the disease they transmit. While you write these answers, I'll take a very short break of just 1 minute and come back. You can also take a break, drink water, tea, washroom, anything, and identify the 3 vectors correctly. I'll just join you very briefly in a minute. Okay, friends, I'm back. आंसर तो आप सबके सही आ रहे हैं. Okay, friends, you are right. Just give me a break. Now let us start. How is the जोश? जोश बिल्कुल हाई होना चाहिए दोस्तों. एग्जाम क्लियर करना है, कुछ भी करो, जो मर्जी करो, एग्जाम में मुझे क्लियरेंस चाहिए. अगर आप एफएमजी एग्जाम दे रहे हो तो 150 से ऊपर चाहिए. अगर आप नीट पीजी एस्पिरेंट हो तो रैंक ब्रांच आपकी चॉइस की चाहिए. ब्रांच कम से कम आपकी चॉइस की आपको मिलनी चाहिए. चलो स्टार्ट करते हैं. फर्स्ट ये है वेक्टर, सेकंड ये है थर्ड। तो ऑलमोस्ट 90% स्टूडेंट्स ने बिल्कुल सही आंसर दिया है। यस अंकित कुमार, जोश शुड ऑलवेज बी वेरी हाई। तो ये है हमारा एडीज, टाइगर मॉस्किटो, बिकॉज देर आर वाइट स्ट्राइप्स ऑन बॉडी एंड लेग्स, और ये पैरेलल होता है while taking a bite to the skin। आप देख भी सकते हो पैरेलल है, with a small hunch around the neck known as hunchback posture। Diseases transmitted, डेंगू, चिकुनगुनिया, येलो फीवर, जीका वायरस, ये आपको याद रखना है। रिफ्ट वैली फीवर भी याद रख सकते हो। सेकेंड वेक्टर इज एनोफिलीज। It sits at 45 डिग्री टू द सरफेस ऑफ स्किन while taking a bite। तो 45 डिग्री पे ऐसे बैठा होता है जब बाइट करता है, आपको दिख भी रहा होगा इमेज में। डिजीज ट्रांसमिटेड, मलेरिया, एनोफिलीज क्यूलिसिफेसिस रूरल मलेरिया, एनोफिलीज स्टीफेंसाई अर्बन मलेरिया। और तीसरा आपका वेक्टर है सैंड फ्लाई, जिसे कुछ स्टूडेंट्स ने हाउस फ्लाई लिखा है। नहीं दोस्तों, ध्यान से देखना इमेज को, ये सैंड फ्लाई है विच ट्रांसमिट, जो कि हम ऑलरेडी डिस्कस कर चुके हैं, काला आजार। इसका बायोलॉजिकल नेम सैंड फ्लाई का होता है फ्लेबॉटमस। डीडीटी इसका इंसेक्टिसाइड ऑफ चॉइस है। काला आजार विसरल लिशमेनियासिस का पॉजिटिव एजेंट है लिशमेनिया डोनोवोनाई। आगे चलते हैं, ये आपके एग्जाम का क्वेश्चन है। विच डिजीज इज ट्रांसमिटेड बाय द वेक्टर शोन इन द इमेज। आप पहले तो वेक्टर को आइडेंटिफाई करो, तभी आप सही आंसर मार्क कर पाओगे। तो मैं आपके आंसर का इंतजार कर रहा हूं। आप मुझे बताइए फ्रेंड्स, टेल मी व्हाट इज द वेक्टर, व्हाट इज द डिजीज। ओके फ्रेंड्स, रात के 11 बजे भी अगर मैं भी लगा हुआ हूं पूरी एनर्जी से और सारे स्टूडेंट्स भी लगे हुए एनर्जी से, तो इसका मतलब वी आर वेरी सीरियस फॉर आवर एग्जाम। वेरी हैप्पी टू सी दिस। वेरी राइट दोस्तों, सबसे पहले सही से आइडेंटिफाई किया डॉक्टर सोयल घरडे ने। ये है हमारा क्यूलेक्स। देखो, ना तो ये टाइगर है, ना ये 45 डिग्री पे है, ये भी पैरेलल विद अ हंचबैक पोस्चर, लेकिन टाइगर नहीं है। तो ये है आपका क्यूलेक्स। तो चारों चॉइस में एक ही है जो क्यूलेक्स से ट्रांसमिट होता है, वो है जैपनीज एनकेफेलाइटिस। तो क्यूलेक्स ट्राइटीनियोरिंकस जैपनीज एनकेफेलाइटिस, क्यूलेक्स क्विंक्यू फेशिएटस या फेटिगन्स लिम्फेटिक फाइलेरियासिस, और वेस्ट नाइल फीवर के लिए होता है क्यूलेक्स पीपियंस। ये आपको तीनों याद रखना। आगे चलते हैं दोस्तों। हाँ, बीच में ये चीज बड़ी जरूरी है, ये आपको याद रखना है। लर्न विद द बेस्ट, और बेस्ट आपको मिलेगा सारा सेरिबेलम एकेडमी पे। कोशिश कर रहे हैं कि 19 के 19 एजुकेटर्स आपको बेस्ट मिले। वी आर मूविंग एट अ वेरी फास्ट पेस, वी आर वर्किंग 24/7 फॉर यू। नीट पीजी के बाद आपको सेरिबेलम भी मिलेगा, राइट। तो फ्रेंड्स, लेट्स मूव फॉरवर्ड। अगर सब्सक्राइब नहीं करा है, चैनल सब्सक्राइब कर लो, क्योंकि इससे आपको और हमारा कनेक्शन बना रहेगा। अदरवाइज तो हम आपको वैसे भी सारे सोशल मीडिया प्लेटफॉर्म्स में मिलते रहेंगे, लेकिन ये एक ऐसा प्लेटफॉर्म है जहां पे हम एकेडमिक्स पे फोकस रखेंगे। मोटिवेशन भी करेंगे, लेकिन सबसे पहले एकेडमिक्स। आगे चलते हैं दोस्तों। दोस्तों अब हम आ रहे हैं, जो बीच में आपके एक फ्रेंड ने कहा था कि सर न्यूट्रिशन की इंपॉर्टेंट वैल्यूज रिवाइज करा दो, तो न्यूट्रिशन की पहले वैल्यूज रिवाइज करते हैं। अगर हम एनर्जी को देखें तो सिडेंट्री लेवल एक्टिविटी, मॉडरेट लेवल एक्टिविटी, हैवी। प्लीज इसमें दोस्तों 5 साल पुरानी बुक्स मत पढ़ना, क्योंकि ये सारी वैल्यूज 2020-21 में रिवाइज हुई हैं। ऑल दीज वैल्यूज हैव बीन रिवाइज्ड इन 2020-21। तो मैं थोड़ा सा राउंडिंग ऑफ कर रहा हूं, आई एम डूइंग अ बिट ऑफ राउंडिंग ऑफ दीज फिगर्स। सिडेंट्री मेल 2100 किलो कैलोरीज पर डे, मॉडरेट लेवल 2700, heavy level 3500. You and me are sedentary because we are sitting. Housewife, moderate level work. Laborer is a heavy work. In a woman, corresponding figures are 1700 kilocalories per day, 2100 kilocalories per day, 2700 kilocalories per day. At least remember these two. If you forget others, in an infant, 550 kilocalories per day in first half of infancy, that is 0 to 6 months of age, and 670 kilocalories per day in second half. These have been asked only in FMGE exam, 550 and 670. And a question which is asked in FMG as well as NEET PG consistently: what is the additional energy requirement in pregnancy? What is the additional energy requirement in lactation? first half of lactation, second half of lactation. These three answers have not changed in the recent guidelines, so you have to mark it correctly. Dr. Vladimir Putin, आज तो पुतिन साहब भी आए हैं हमारे सेशन अटेंड करने रशिया से. ओके, तो आपका लेकिन आंसर सही है. प्रेगनेंसी प्लस 350 किलो कैलोरीज पर डे. लैक्टेशन फर्स्ट हाफ एंड सेकंड हाफ, it is plus 600 kilocalories per day and plus 520 kilocalories per day. Friends, from energy requirements, these are the minimum values. I'm not giving you more. These are the minimum values you have to remember from energy. Similarly, let us look at these 5 important nutrients which are asked in the exam. Iron is measured in milligram per day. Folic acid, microgram per day. Iodine, microgram per day. No need to write this in the chat box, just you can revise. Vitamin A is in microgram per day of retinol equivalent. Vitamin D for the first time has been now laid down for Indian population international units per day. So let us start with iron. 19 in a man, 29 in a woman. In pregnancy it becomes 40, then reduces to 23. This is the actual iron recommended intake. Requirement is only 1 to 2 milligram per day. Folic acid, I'm just rounding off few figures here. 300, 200, 600 and 330 microgram per day. Okay, maybe I can do one thing. I will keep on circling what has been asked in your exam. Here you have been asked for pregnancy for folic acid. Okay. Then when we look at iodine, 150 microgram per day is in adult male female. Pregnancy it becomes 250, lactation it becomes 280. Adult man, woman and pregnancy iodine requirement has been asked in the exam. When we look at vitamin A, these guidelines have been changed recently. Now it is 1000 microgram per day of retinol equivalent, 840, 900 and 950. In this, adult man, woman requirement has been asked. Vitamin D, easiest to remember, everyone is having 600 international units per day. Beside this, fluorine requirement, I think you should know, optimum fluoride intake is 0.5 to 0.8 milligram per liter or ppm. Okay, I know I'm going a bit faster, but we have to cover each and everything today. Then friends, also, yes, Dr. Shilpanand is saying food adulteration. A lot of questions of food adulteration will come shortly, which appeared in recent examinations of FMGE and NEET PG, friends. So don't worry. It's my duty to cover everything. After today's session, your energy level will be at the sky high level. Don't worry. Okay, we move to the next set. Tell me the richest source of essential fatty acid, proteins, saturated fats. Please remember, friends, I want all the 3 correct answers. Yes, Dr. Kumar Kopal, iron requirement is different from Anemia Mukt Bharat. Anemia Mukt Bharat is tablet supplementation and iron absorption in body is 10% only. So supplementation will do higher, requirement is less. इंग्लिश वर्जन आएगा सेरिबेलम ऐप पर गजेंद्र जी, बिल्कुल आएगा, उसके बिना कैसे काम चलेगा. इंग्लिश में तो हमारी जान है, बिल्कुल आएगा. Is this for NEET PG? Yes, NEET PG, FMG, both have similar examination body, friends. You have to understand. Okay, we have started getting the correct answer. Essential fatty acids, yes. Safflower oil. If it is not in the choice, sunflower oil followed by corn oil. What about proteins? Okay, we are getting the egg as the answer. Egg, but only one student, Dr. Adil Hussain, has marked correct. Friends, it is not egg, it is soya bean. Let me correct you again. I know आपको रात के 11 बजे you are feeling tired, but we have to mark correct. Quantity soya bean 43%. Quality egg NPU 96. Quality is more important, so egg is the reference protein of India. But the question was richest source. Then you have to advise someone maximum content of protein is present in soya bean. Please be correct for this. Saturated fats, many of you have marked correct. This is coconut oil. See, there is no controversy in the any question I have discussed till now. If there is a controversy, I will tell you, but here answers are available with values. Similarly, quickly tell me richest source for vitamin C, vitamin D and iron. These are all your former exam questions of National Board Examinations, FMG and NEET PG. Vitamin C, what is the richest source? Okay, it is amla, Indian gooseberry, followed by guava. Vitamin D, no one has written till now. I am waiting, friends. Yes, Dr. Invisible, you are marking all the visibly correct answers. This is halibut fish liver oil. दोस्तों ये अपने करेक्ट आंसर्स का जो ये मोमेंटम है ना, इसको एग्जाम तक लेके जाना है. एग्जाम में बिल्कुल ऐसे रेप्लिकेट करना है. इसी थॉट प्रोसेस जितना आपका फास्ट इस वक्त चल रहा है ना, फास्ट और एक्यूरेसी दोनों होने चाहिए. एग्जाम में किसी का एक भी क्वेश्चन नहीं छूटना चाहिए. आपके एफएमजी एग्जाम में तो कोई नेगेटिव मार्किंग भी नहीं है. देयर इज नो स्कोप ऑफ एनीथिंग. नीट पीजी स्टूडेंट्स, यस यू हैव टू टेक नेगेटिव मार्किंग इनटू अकाउंट, बट स्पीड एंड एक्यूरेसी इज डिजायरेबल. और आयरन का किसी ने नहीं बताया. डॉक्टर गांधला जीवन ने सबसे सही और सबसे करेक्ट आंसर दिया. इट इज ड्राइड पंपकिन सीड्स. Many students are marking red meat, that is also one of the richest source, but dried pumpkin seeds followed by cashew nut and pistachio are the richest sources of iron. Richest पूछा मैंने, तो हमेशा सिंगल आंसर होगा इन क्वेश्चंस का. आगे चलते हैं दोस्तों. रिसेंटली आपके एग्जाम में ना फूड एडल्ट्रेशन से काफी क्वेश्चंस आए हैं. फ्रेंड्स, रिसेंटली फ्रॉम योर एग्जाम a lot of questions on food adulterations have been asked in both FMG and NEET PG. So let us look at that. Okay, before that, identify two disorders which come in every year, not food adulteration. So quickly identify, diagnose this disease. Rahul, jaggery is not the richest source of iron. It is the cheapest source of iron. Richest source is dried pumpkin seeds. Okay, friends, these two conditions come in your exam alternatively. At diagnosis, please tell me. First is zinc deficiency. What is this known as condition? Yes, acrodermatitis enteropathic. So patient, you can see the skin, there is brittle nails, there is even sterility if adults are affected, right? And there is alopecia, diarrhea is there. And second condition, very right, this is Castle's necklace around the neck of a person. Very right, it is due to pellagra, and which is due to niacin deficiency, vitamin B3. Typically seen in maize eating population because maize is deficient in tryptophan, but the major culprit is excess of leucine. Chi-urenin pathway, please read from biochemistry. 60 milligram tryptophan is converted to 1 milligram niacin in the body. Let's move further. Okay, first question from food adulteration. Mark the correct answer. A man is working in a place where they store ground nuts. They have some poisoning. Most likely, this is which poisoning? Tell me the poisoning which is due to food adulteration. Also tell me which organisms are involved. I'm waiting for your answer. Okay, let us see who gives fastest finger first. Okay, fastest finger first. Prize goes to Dr. Qazi Saifuddin. No doubt at all. Okay, Dr. Arvind Yadav, you are also correct, dear. Dr. Fanny Nanda, you are correct. Dr. Sean Murphy, मेरा भी favorite character है यार web series में. You are also correct. Dr. J. Lakheda, Dr. Neha Singh, most of you are correct. But friends, few of you are marking this wrong. See, groundnuts we are looking at. Groundnuts में which food poisoning is there? Food adulteration, that is aflatoxicosis. You have to remember, it is due to Aspergillus flavus and Aspergillus parasiticus. So aflatoxicosis, contamination of groundnuts if they are stored for very long time by Aspergillus flavus and Aspergillus parasiticus. Toxin is by the same name, aflatoxin. Second question, recent question, I'll read it slowly. Mark the correct answer. Patients from different age groups from a village in West Bengal came to a clinic with illness. Suppose you are the medical officer of this clinic. On examination, you find that all of them were having edema. So first important thing is all are having edema. On history, it was found they were consuming mustard seed. This is the second clue. Bought from the same local shop. So it has to be food adulteration, all of you. If you can notice that all of them are getting the same symptom. So which disease are we talking of? Which food adulteration disease? Consumption of mustard seed. Very right. This is epidemic dropsy. And it is not the mustard seed which is dangerous. Mustard seed or oil which is contaminated with Argemone mexicana oil. Dropsy leads to bilateral non-inflammatory edema of lower limbs, glaucoma, congestive heart failure, death. And what is the main mechanism of action? It inhibits pyruvic acid oxidation, which leads to all this manifestation. And what is the toxin? Most of you are marking correctly, sanguinary. In letharism, which is Lathyrus sativus khesri dal, toxin is BOA, beta-oxalyl aminoalanine. And this question came recently. Can you identify what is shown in this photograph? And second was, how will you diagnose this? Let us see how many of you can attempt this question correctly. This came as a theory question. I am giving you it as an image-based question. Look at the screen carefully. Okay, most of you are marking correctly, but what is shown in the photograph? Friends, this is what is shown in the photograph is ergotism. A question was asked in your exam, if ergot, in which there is claviceps purpurea, it infests a particular food crop like bajra, you are saying, or maize, how do you diagnose it inside a home also by a common test? Let us see who has given the first correct answer. Dr. Vaibhav, you are right. Dr. Amar Singh, you are right. Dr. Amar Singh, you are right. Dr. Nixon Burat, you are right. Dr. Vaibhav, very happy friends. Here we use 20% salt solution. Please remember the concentration. What we do, we put the grains in which ergot is also there. You will find that if you put it in 20% salt or brine solution, then ergot will float. Ergot will appear purple or dark brown, if you can see the image carefully, whereas healthy grains will settle in the bottom. So not only you can diagnose there is ergotism or ergot infestation, you can separate them. Healthy grains could be dried and reused later. So forget everything. Ergot could be separated. Purple brown seeds of ergot could be separated from the healthy grains of maize, bajra by using 20% salt solution is what you have to remember. So 20% salt solution. So friends, after nutrition, we move to sociology. Identify what is shown in this photograph. And second question, what is the score of the top category? And third question, it is based on which three parameters? So look at the image carefully. Socioeconomic status. What is shown in the photograph is a scale which is used for urban families. So which is this scale? Yes, Dr. Ryan, Dr. Vikram Ehlawat, you are absolutely right. Dr. Amritansh, Dr. Bruce Wayne, you are also right. This is modified Kuppuswamy scale. In rural areas, we use BG Prasad scale. So Kuppuswamy scale is for urban families. Second question was, what is the highest category score? That is upper class, 26 to 29. This is the latest question which was asked. And third, what are the three components of modified Kuppuswamy scale? It is income, education status. This is used for head of the family, and occupation status also used for head of the family. So Families could be divided into 5 parts: lower, upper lower, lower middle, upper middle, and highest upper class 26 to 29 score, which is based on income, education, and occupation. Let's move further. After sociology, we move to health communication. Communication of cancer prognosis is done by, see how a question came in your exam, they'll make it a clinical question. You are a medical officer in a hospital, you are a surgeon, you are an oncologist, you have diagnosed a patient is having 27-year-old male patient is having lung cancer. How will you explain diagnosis, prognosis to the patient? The surgeon, oncologist, or as a doctor, you have to use a particular health communication methodology known as, friends, I'm still waiting for your answer. First correct answer, let us see how many of you know. Dr. Dream Big, absolutely correct. Dr. Ranveer, Dr. Kiran Deshmukh, you are right. It is Spike's technique. Communication of any adverse outcome, especially cancer diagnosis and prognosis. Second question, gather approach is used for. Gather is actually a 6-step approach like Spike's: greet, ask, tell, help, explain, return, visit. Its older name is cafeteria approach. What is it used for? This was the question. Dr. Sumit Navrarkar has given the first correct answer. This is contraceptive counseling. Also, one of the latest questions, what are the number of members in a focus group discussion? Let us see how many of us can mark this correct. Latest question. They made it a lengthy question just to confuse you. You are a medical officer of a PHC. You are conducting a focus group discussion with members of the village regarding benefits of exclusive breastfeeding. How many members will be included in the focus group discussion total? Waiting for your answer. There is a lag because when we do a live streaming, there is a lag of around 10 to 15 seconds. Okay, Dr. Invisible again, first correct answer, Dr. Rain, Dr. Kopon, you have written in some other language, most likely some Russian belt language. Okay, Dr. Kajal, Dr. Kazu, every one of you is right, friends, barring few wrong answers we are getting. We have total 6 to 12 members, including one group leader, which you are the group leader, you are the medical officer or the doctor. And there is one recorder person who records our discussion, and he made a diagram of interaction between the participants, known as sociogram. Now, a question was asked in your exam. Can you identify? I'm showing you an image for that question. Which health communication methodology is shown in this photograph? Look at the image carefully. I am showing you one more photograph to help you identify. Waiting for your answer. It's not that images will come. I'm giving you images so that you are bound to think, because there may be long, lengthy clinical questions. Dr. Ryan has given the first correct answer. Dr. Divya Rukwal, Dr. Vinay, Dr. Dreambig, Dr. Jha, Dr. Nambika, Dr. Arman, all of you are correct, friends. Let me tell you the question of your exam. A female health worker has to teach women in urban slum about ORS preparation. So if you see the images carefully, in first on the table they have kept ORS. In second, the nursing staff is telling ORS. So ORS preparation, what is the best health communication methodology? That is demonstration. Based on two principles, learning by doing and seeing is believing. Okay, one of the latest questions, agency promoting health awareness in the country. This question you can solve even by, let us say, exclusion. Central Bureau of Health Intelligence. It will give you health intelligence, which will help in policy and program making. ICMR, Indian Council of Medical Research. So medical research we are doing. National Medical Library. It is a library of book. So health awareness is health education. So that will be done by Central Health Education Bureau. So answer to this question is choice number C. All the four agencies, CBHI, ICMR, CHEB and NMS, are based at New Delhi. कुछ तो गौतम नगर के ही पास है दोस्तों, इनमें से एक दो तो गौतम नगर के पास है, ICMR and National Medical Library. Okay, let's move further. After health education, we move to occupational health. Friends, pneumoconiosis, these are diseases, respiratory diseases which occur due to occupational dust exposure. Mark these latest questions. What I've done is 5 latest questions I've picked. Pneumoconiosis. It is a type of physical, chemical, biological, or mechanical hazard. It is a type of chemical hazard. Let us see how many of you can mark all the 5 answers correctly. Most dangerous particle size, Dr. Qazi Saifuddin, you are right, dear. Okay, Dr. Ankit Pandey says good morning. Yes, friends, it is good morning. Till we sleep, till we prepare PSM best, it is always good morning. Yes, video is going to stay on the channel, but if you leave right now, be sure my last 17 years of experiences, you will not come back to see the video. Video and PDF, we just keep on accumulating on Telegram. No one sees it. Occupational, yes, it is. Okay. Dangerous particle size. Please keep on correcting and marking your answers in the notebook if you're wrong. It is not the smallest. It is the second smallest particle size, 0.5 to 3. It's not less than 0.5. It is 0.5 to 3. Shipyard workers. Latest question. Asbestosis. Bicyanosis is most commonly seen in farmers, spinners, weavers, or packers. It is in spinners. None of you has told the organism for farmer's lung. Dr. Amritansh has told. Dr. Sumit Navrakar, you are right. Dr. Amritansh, you are absolutely correct. This is micropolyspora. Farmer's lung is due to moldy hay, but the organism involved is micropolyspora feniae. And mesothelioma, asbestosis. Lovely. Let's move further, friends. Another question. A person who has been working in dye industry now presents to OPD with symptoms of bladder problems. Most probable diagnosis. Dye industry, urinary cancer. Which cancer is the most common subtype, friends? Okay, here we are marking the correct answer. Transitional cell carcinoma, bladder carcinoma. Okay, let's move further. Now we shift to primary health care. What are the principles of primary health care? There are 4. I am writing in your screen. Please revise side by side. First is equitable distribution. Geographic, economically, equity should be there. Where same services will be available in primary healthcare. Second is community participation. What is the best example of community participation in healthcare system of India? It is ASHA worker. Third principle, appropriate technology. Technology should be cheaper, but results should be like expensive technology. 3 best examples: exclusive breastfeeding, ORS, and one you have to remember, standpipe. One of the popular questions in exam. Standpipe is an example of appropriate technology. And fourth one is intersectoral coordination. Do not mix these 4 principles of primary healthcare with 8 elements of primary healthcare. This was one of the recent questions. What is the first referral unit of India? First referral unit of India. See, primary level is first level of contact, subcenter PHC. After that, secondary level is the first referral unit. So what is there in secondary level becomes the answer. That is community health center and sub-district hospitals and district hospital. Then we have tertiary level, which is delivered through medical colleges. Friends, few of you have marked this answer wrongly. I am surprised. I'll repeat. Primary level, first level of contact, subcenter and PHC. Secondary level of healthcare is the first referral unit, CHC, sub-district hospital, district hospital. Tertiary level, Second referral level is medical colleges of our country. We have to mark this answer correctly, please. Quickly tell me population norms for these four, where you tell me for plains and hilly tribal areas separately. I'll just write it. Please revise along with me. Sub-center in plains is 1 per 5,000. Hilly areas 1 per 3,000. Primary health center 1 per 30,000 in plains, 1 per 20,000 in hilly tribal areas. Just check how many of you are attempting these particular questions correctly, because a single question could be decisive in our case. One community health center is per 1,20,000 in plains and 80,000 in hilly tribal areas. One Anganwadi is for 400 to 800 in plains and 300 to 800 in hilly areas. Out of these questions which I am circling have been asked in our examination. So take a screenshot, but I am believing all of you are right. Dr. Mukesh Sharma, very happy to see when you have written that all of your answers were right. This is what we want from every student in the exam. We have to get our balance right, right? So just use your cerebrum, maintain cerebellum for getting your balance right. Let's move further. Friends, also tell me all these population norms. Asha, one of the friends asked earlier in the session, is 2 per 1,000, 2 per village. See, earlier it was 1 per 1,000, 1 per village. We achieved it in 2011. So 11 years ago, we made it 2 per 1,000, 2 per village. But if 2 per 1,000 is not in the choice, you have to mark the 1 per 1,000 answer, but that is older. Asha should be 25 to 45-year-old female. Minimum 10th pass she should be. Under NRHM program, IMR is the best indicator of her assessment. Multi-purpose worker is 1 per 5,000 because he and she is posted at sub-center. Traditional birth attendant village, so 1 per 1,000. Village health guide village 1 per 10, 1 per 1,000. So village is always 1,000. Please remember. One TB center. प्रमोशन चलता रहना चाहिए, बिल्कुल दोस्त. प्रमोशन के बिना क्या लाइफ है. जब हम प्राइवेट प्रैक्टिस में आएंगे, प्रमोशन आप देखोगे वहां पे भी जरूरी है, नो मैटर हाउ गुड अ क्लिनिशियन यू आर. वन टीबी सेंटर इज फॉर, इफ यू सी टीबी सेंटर में डेजिग्नेटेड माइक्रोस्कोपी सेंटर, दिस इज 1 पर 1 लाख पॉपुलेशन, उसे आप टीबी सेंटर कहते हो. लेकिन अगर आप टीबी यूनिट को देखो, इट इज फॉर 5 lakh population in plains, 2.5 lakh population hilly area. Okay, one of your friend has a very unique name, attention span of a cockroach. I love your name, dear, but your answers are correct also. So one TB unit is for 5 lakh population in plains, hilly areas. It is 2.5. Set center, survey, education, treatment. This is for leprosy program. It is 1 per 20,000 to 25,000 population. One of the recent questions, school health is the responsibility of. So I've used an image. They did not use the image. It was a theoretical question. It was asked in FMG also, NEET PG also. School health is the responsibility of. Okay, we are getting answers. Primary health center, teacher, primary health center. Friends, very right. Primary health center is the correct answer. Class teacher is not responsible for health of the student. Please remember, friend. Class teacher has a role in school vision screening program, where she has to measure the visual acuity of a child. If less than 6/9, refer the child. But she is not responsible for health of the child. School health is the responsibility of primary health center. They will do all the examination and they will take corrective measures if required. So do not mix two different things. After healthcare system, we move to management techniques. One line definition for 3. Cost effective analysis, systems analysis, network analysis. Cost effective analysis, where output is in terms of results achieved. COVID vaccination has saved 2 crore human lives in India so far. Number of human lives saved is a result. Cost effectiveness. If output is in terms of money, cost benefit. Systems analysis, where we compare two or more cost effective alternatives in a program. Should we go for diagnosis by rapid antigen test or RT-PCR? We look at cost of both and effectiveness of both and compare and choose the better method. Network analysis, two techniques. One is PERT, program evaluation and review technique. This is sequence of activities in a program. And its second part is CPM, critical path method, which is the longest path in terms of duration. Longest path in duration. प्रोग्राम ओके 120 इज आस्किंग कि सेशन अभी भी लाइव चल रहा है. यस दोस्त, मैं तो पूरी रात पढ़ाता रहूंगा जब तक आप थकोगे नहीं. बट लेट अस ट्राई टू एंड दिस सेशन बाय 12:5. 3 घंटे में आपकी बहुत कॉम्प्रिहेंसिव रिवीजन हो रही है, आई कैन सी. ओके, डॉक्टर अंसारी सेइंग कि सर एक डाउट है, सारे लोग बोल रहे हैं कि आशा वर्कर इज 1 पर 1000. दोस्तों अगर 2 पर 1000 चॉइस में दिया हुआ है तो आपको 2 पर 1000 ही मार्क करना है. चलो मैं आपको एक सिंपल चीज बताता हूँ. इंडिया है 7 लाख विलेजेस. इंडिया हैज 10 लाख आशा वर्कर्स राइट नाउ. 7 लाख विलेज है और 10 लाख आशा वर्कर है. तो 1 पर 1000, 1 पर विलेज तो हम कब का अचीव कर चुके हैं, 10 साल पहले. नाउ द नॉर्म इज वी वांट टू हैव 2 आशा वर्कर्स पर विलेज, और वो भी हमने 50% विलेजेस में अचीव कर लिया है. जो आपको बता रहा है वो अपडेटेड नहीं है क्योंकि गवर्नमेंट ऑफ इंडिया की वेबसाइट पे ये अपडेटेड नहीं है. बट आप अगर यूनिवर्सल हेल्थ वाला, यूनिवर्सल हेल्थ फॉर ऑल वाला अगर आप डॉक्यूमेंट पढ़ोगे, उसमें लिखा है वी वांट 2 आशा वर्कर्स पर 1000 पॉपुलेशन. वो चॉइस में नहीं है, तब आप मार्क कर सकते हो 1 पर 1000. वो लेकिन पुराना क्वेश्चन है, एग्जामिनर भी शायद अपडेटेड नहीं है, उसमें बड़ी प्रॉब्लम है. तो ट्राई टू गो फॉर द लेटेस्ट आंसर. लेट अस बिलीव कि एग्जामिनर को ये पता होगा. आगे चलते हैं. ओके, मैनेजमेंट टेक्निक में एक क्वेश्चन आया था. इनफैक्ट डॉक्टर सतबीर सिंह, आपने तो पूछ भी लिया मुझसे ये. इन अ हॉस्पिटल मैनेजमेंट वांट्स टू नो हाउ मच टाइम इज डॉक्टर इज स्पेंडिंग विद पेशेंट ऑन एन एवरेज. हॉस्पिटल में ना सिर्फ डॉक्टर को इवैल्यूएट करते हैं, हेल्थ वर्कर्स और स्टाफ को कोई नहीं इवैल्यूएट करता. दे वांट टू इंक्रीज डिक्रीज नंबर ऑफ डॉक्टर्स. प्रॉब्लम भी हमेशा डॉक्टर्स के साथ आती है. एज पर द रिक्वायरमेंट टू इंप्रूव क्वालिटी ऑफ केयर. क्वालिटी ऑफ केयर का जिम्मा भी डॉक्टर्स का ही है. व्हाट इज द मैनेजमेंट टेक्निक दे शुड यूज. बहुत ही सिंपल क्वेश्चन को थोड़ा लेंदी बना के उन्होंने पूछा था. व्हाट इज द आंसर. आशा वर्कर शुड बी 10th पास मिनिमम, लेकिन रिलैक्स कर सकते हैं अगर कहीं पे अवेलेबल ना हो. बिल्कुल सही, ज्यादातर दोस्त बिल्कुल सही जवाब दे रहे हैं. वर्क सैम्पलिंग, सैम्पलिंग टू असेस क्वालिटी ऑफ वर्क इन अ हॉस्पिटल. तो डॉक्टर्स के लिए भी यूज करते हैं, बाकी स्टाफ के लिए भी यूज करते हैं इसको. दोस्तों हेल्थ मैनेजमेंट के बाद हेल्थ प्लानिंग कमिटीज में से मुझे सिर्फ 4 बता दो जो लेटेस्ट उन्होंने पूछे. विच कमिटी फर्स्ट रिकमेंडेड स्कूल हेल्थ इन द कंट्री. Which committee recommended multi-purpose worker, Rome scheme, integration of health services? देखते हैं किसका आंसर सही आता है सबसे पहले. 4 क्वेश्चंस को मैं इकट्ठे पूछ रहा हूं ताकि आप फटाफट रिवाइज कर सको. डॉक्टर रेडिकल ने सबसे पहले, डॉक्टर सोनल चौधरी ने सबसे पहले सही आंसर दिया. यह है भोर कमेटी. दोस्तों 2 अलग अलग क्वेश्चन है, बड़े ध्यान से सुनना. पहला क्वेश्चन है, स्कूल हेल्थ वॉज फर्स्ट रिकमेंडेड बाय भोर कमेटी 1946, but school health guidelines were given by Renuka Roy Committee 1960-61. Multi-purpose worker, most popular question was given by Kartar Singh Committee. Reorientation of medical education, Rome scheme, this was given by Sri Vastava Committee. Integration of health services, he also gave. Ban on private practice by government doctors, Jangalwala Committee 1967. तो health planning committees, I believe Kiran Deshmukh Bhor committee was 1943 formed. It was formed in 43, but its recommendation year was 1946. This you have to correct, right? Okay. So Bhor committee formed in 1943. Recommendations were given in 1946. After health planning committees, we move to international health. Identify the organization. Tell me what is the location of headquarters. Tell me when it was established. Tell me when its constitution came into force. 4 different questions. One of the popular topics. Okay, it is WHO, very right. Headquarters located in Geneva, established 1945. Constitution came into force 7th April 1948. Second organization, sorry, it is getting hidden under this what I've already written, but you can identify. This agency is UNICEF. 2 questions. One, what is C? Second question, where are its headquarters? UNICEF, what is C? Care, child, children, none of the above. Let us see how many of us mark this correct. Care, child, children, or none of the above. This was the question. National Board is very fond of abbreviations, friends. Session will finish by 12 o'clock. Okay, so few are saying child, some are saying children. Friends, but one of them has to be correct. It is United Nations International Children Emergency Fund, headquarters in New York, and they are running Gobi FFF campaign. Growth monitoring, ORS, breastfeeding, immunization, family planning, food supplementation, and female education. Right. SIDA, DENIDA. Which programs they are supporting? SIDA is Swedish International Development Agency. Which health program of India they are supporting? DENIDA is Danish International Development Agency. Which health program they are supporting? 2 common questions repeatedly asked in National Board papers. डॉक्टर जॉर्जियो सिंह सर 1 बजे तक क्लास ले लो, कोई मुश्किल नहीं है। दोस्तों मेरे लिए तो नहीं है मुश्किल, लेकिन आप लोगों को प्रॉब्लम हो जाएगी, क्योंकि मेरी जो वैसे भी पीएसएम की लाइव क्लासेस होती है ना, वो 9 o'clock से 9 o'clock ही होती है मैक्सिमम, 5 दिन लगातार 45 आवर्स होता है उसमें, राइट। ओके, बट आपका टाइम भी इंपॉर्टेंट है, आपके लिए सिर्फ पीएसएम नहीं है, बाकी 18 सब्जेक्ट भी पढ़ के जाना है। डोंट वरी, लेकिन इस सेशन में सब कुछ कंप्लीट करवा दूंगा, आपकी कॉम्प्रिहेंसिव रिविजन। ओके, मेनी ऑफ यू आर राइट। थोड़ी थोड़ी गलती 1-2 स्टूडेंट्स कर रहे हैं। सीडा सपोर्ट करता है इंडिया के टीबी प्रोग्राम को शुरुआत से, और डेनिडा शुरुआत से सपोर्ट करता है इंडिया के ब्लाइंडनेस प्रोग्राम। इसके अलावा आपको याद रखना है यूएनएफपीए, यूनाइटेड नेशंस फंड फॉर पॉपुलेशन एक्टिविटीज, ये सपोर्ट करता है आरसीएच फैमिली प्लानिंग कंपोनेंट को। ये आपके क्वेश्चंस। ओके, डॉक्टर आलम पूछ रहे हैं कि सर इम्यूनाइजेशन शेड्यूल रटने की कोई ट्रिक? रटना नहीं होता दोस्तों, पढ़ना होता है। आराम से आप एक बार पढ़ लो, उसमें फोकस क्या करना है बता देता हूँ। इम्यूनाइजेशन शेड्यूल में बीसीजी इज गिवन एट बर्थ, मीजल्स इज गिवन एट 9 months ऑफ एज एंड 16 to 24 months, 2 डोजेज है। जेई का मैंने आपको आज बता ही दिया। इसके अलावा वाइटामिन ए के टोटल 9 डोजेज, 17 लाख इंटरनेशनल यूनिट्स है। इसके अलावा आप बाकी बस पढ़ लो। टेटनस की जगह टीडी आ गया है 10-16 ईयर्स और प्रेगनेंसी में, और लेटेस्ट चेंज क्या है, आईपीवी को हमने 9 months पे 3rd डोज इंट्रोड्यूस किया है, बट वो पूछेंगे नहीं। ओके, डॉक्टर रेड्डी, डॉक्टर इशाक कतरे कह रहे हैं हेलो अपूर्व सर। अपूर्व सर भी सेशन में, थैंक यू सर फॉर बीइंग अ पार्ट ऑफ दिस सेशन एट सच अ लेट टाइम लाइक ऑल अदर स्टूडेंट्स। पीडीएफ दोस्तों आपको मिल जाएगा, मेरे से व्हाट्सएप पे ले लेना, नहीं तो हमारे सेरिबेलम का जो आपका टेलीग्राम का चैनल है ना, उसको ज्वाइन कर लो, उसमें डाल दूंगा मैं। ओके, आगे चलते हैं दोस्तों। इससे काफी क्वेश्चंस आते हैं। एक ऐसा क्वेश्चन आया जिसमें काफी सारे स्टूडेंट स्टंप हो गए इन द सेंस कि उन्होंने आंसर गलत मार्क कर दिया। क्वेश्चन था कि इसको किस एजेंसी ने दिया। तो सबसे पहले तो आपको बताना है ये है क्या, फिर इसका टारगेट ईयर बताना है, इसमें कितने गोल्स हैं और कितने डायरेक्टली हेल्थ रिलेटेड हैं। ओके, सबसे पहले सही जवाब दिया है डॉक्टर अनामिका ने, ये सस्टेनेबल डेवलपमेंट गोल्स हैं। किस एजेंसी ने दिया, इसमें कुछ स्टूडेंट्स ने गलत आंसर मार्क किया था। इसका आंसर डब्ल्यूएचओ नहीं है, इसका आंसर है यूनाइटेड नेशंस। तो यूनाइटेड नेशंस में यूएनडीपी है, यूनाइटेड नेशंस डेवलपमेंट प्रोग्राम, उनका एक असेंबली सेशन था ये 2015 से 2030 के लिए आए हैं। पहले जो मिलेनियम डेवलपमेंट गोल थे वो 15 साल के लिए थे, 2000 से 2015। Sustainable development goals have replaced millennium development goals, and therefore next 15 years, 2015 to 2030, total there are 17 goals, and only one goal is directly health related. And which is that goal? That is goal number 3, health and well-being of the population. Minimum to maximum, you have to remember this. Then let us move forward. When do we observe World Health Day? What is the World Health Day theme of the current year 2022? Tell me, friends, World Health Day. When do we observe? I'm waiting for your answer. Let us see who gets the fastest correct answer. Quickly, friends. Okay, all of you have started giving correct answer for this. This is 7th April because its constitution came on force, as I discussed, on 7th April 1948. And World Health Day theme of this year is this, which is on the front of you. Our planet, our health. Maybe just have a look at the image if we can remember, but most of you are writing correctly. I'm happy to see that. Dr. Mohan Chai, no, mental health is not our planet, our health. Every year there is a new theme. I will not ask you to remember the older themes, at least the latest one. So let us remember our planet, our health. Now, after this, we move to biomedical waste management. First question, identify the symbol. This is radiation hazard. It has an outer circle, inner circle. What is the radius of inner circle? ऐसे क्वेश्चंस भी आपके नेशनल बोर्ड में ही आते हैं सिर्फ. What is the radius of the inner circle? It is 1.5 r. Can you identify? 2023 की थीम तो अभी नहीं आई है, तो एग्जाम में आने का मुश्किल चांस है. वो ना उसके आसपास ही थोड़ी वैल्यू बनती है उस थीम की. तो 22 का ही याद करो दोस्तों. रेडिएशन हैजर्ड 1.5 r. दूसरे का सिंबल बताओ फटाफट, कौन सा है ये? नहीं, डेंजरस तो नहीं. सेकंड का कोई आंसर ही नहीं दे रहा यार. आइडेंटिफाई द सेकंड सिंबल. व्हाट डज इट रिप्रेजेंट? एट मेनी प्लेसेस वी हैव सीन. नहीं, डेंजर नहीं है. डेंजर इज नॉट द आंसर. डेंजर तो ये फिर सब कुछ आ जाएगा. नन ऑफ अस इज मार्किंग करेक्टली. नो, इट इज नॉट बायोहैजर्ड. बायोहैजर्ड का भूल गए क्या? वो 3 वाला होता है. No, it's not chemical hazard, friends. You'll have to remember this is a symbol of poison. Poison का symbol है. Biohazard का वो 3 वाला होता है जो intersect कर रहे होते हैं एक दूसरे को. गलती नहीं करनी है. Biohazard और biomedical waste same होता है. And this is a symbol of, yes, recycling. ध्यान से मार्क करना है. रोड ट्रैफिक एक्सीडेंट नहीं है, इलेक्ट्रिसिटी नहीं है, कॉशन नहीं है. दिस इज पॉइजन, जो सेकंड वाला है, इसको ध्यान रखना बस. बाकी तो आप मार्क कर लोगे, आई नो. ओके, फटाफट करते हैं. वाइट. तो टेल मी 2 आंसर्स. Which waste goes into it? What is the disposal mechanism? Waste which goes into white container. It's not a bag, it is a container, because it is sharp material. Needles, scalpel, blade, scissors. And what is the final disposal mechanism? After autoclaving dry heat, we subject it to destruction and shredding. Finally, it goes into foundries, iron foundries, after they are ground into smaller particles, or landfill or pits. So remember 2 things. Waste sharp goes into white, Iron foundry is the final disposal mechanism. Blue, again 2 questions. What goes into it? What is the final disposal mechanism? What goes is metallic implants. Please remember, heart pacemaker is included in this. Metallic implant, ENT, cardiovascular, ortho, dental, they use it, and glassware. After using chemical treatment, autoclaving, hydroclaving, microwaving, what is the final disposal mechanism? Anyone can tell? I'm waiting for the final disposal mechanism answer. None of you is answering. You're answering. Okay. Okay, finally. Dr. Amar Singh has answered correctly. This is recycling. Like mercury also we recycle. Blue cardboard boxes, the matter inside is metallic implant glassware, that also we recycle. Then red. What is there in red is contaminated recyclable waste. So all your plastic and rubber waste, syringes, bags, etc. After autoclaving, hydroclaving, microwaving, destruction, shredding, what is the final disposal mechanism? It is sent for road making. We can also do energy, oil, fuel recovery from this. And finally, whatever other waste is left, that goes into yellow bag. So it will include animal waste, anatomical waste, microbiological, biotechnological, chemical waste, linen, mattresses, cytotoxic expired medications. All of this, what is the final disposal mechanism except the liquid or the chemical waste? It is incineration. We have to memorize this. Okay, friends, let's move further. We come to genetics. Identify the law of genetics, which is shown in this particular photograph. Identify the law of genetics, which is shown in this particular photograph. Okay, most of you are marking correct answers. That is so good to see. And most of you are still in this session. That shows the seriousness. Definitely all of you will clear the exam, friends. Okay, so Dr. Rahul has answered this correctly first. This is Hardy-Weinberg law of genetics. Now let me quickly tell you important things about Hardy-Weinberg law. Number one, definition. Frequency of genes remain constant from one generation to another. Total genes in human genome found were 19,500 genes. 3 billion base pairs, but genes are 19,500. So frequency of genes will remain same. This is not a law of Mendelian genetics. This is a law of population genetics. This law is applicable only if it is large population, static population. There is not much out migration, in migration number is almost same. And if there is random mating population. Hardy-Weinberg law will be a failure if it is small population, if it is dynamic population, non-random mating, selective mating, assortative mating, if there is a mutation, if there is a natural selection theory, if there is a gene drift. So all this will lead to failure of Hardy-Weinberg law. Let's move further. Coming, friends, now to statistics. Identify the diagram which has been coming in both FMGE and NEET PG exam since last 3 years. Identify the diagram. Thank you, Dr. Praveen sir, for being a part of this session. Yes, sir has written absolutely correct. If you are hardworking, you will definitely clear the exams. We all pray to Almighty from Cerebellum team and from all the platforms rather, that all of you clear your exam as per your desire. Okay, many students have started marking this answer correct. See, is it a histogram? Histogram is for continuous quantitative data. So bars are attached to each other. But if there is a gap between the bars, that means it is qualitative discrete data. So definitely this is a bar chart, because you can see there is a gap between the bars, but each bar is having some sections or components. So this is a component bar chart. You have to remember. Second question, identify the diagram shown here. Yes, first you identify the diagram, and second, it is used for which statistical or epidemiological parameter. Okay, let me wait for your response. Dr. Amar Singh has given, Dr. Sumit has given the correct answer. This is a scatter diagram. What does it tell us? It tells us correlation, relationship between two quantitative variables, and we measure it by correlation coefficient R. Now we go into slightly more technical detail. These are three types of scatter diagram, number 1, 2, and the central one is number 3. Can you interpret which type of relationship or correlation is shown? Can you tell me the value of R in these three? We start with number 1. This is line is having a positive slope, so positive correlation. If you increase one variable, other will increase, and R will lie between 0 to +1. After that, look at number 2, line is having a negative slope, so negative correlation. If you increase one variable, other will decrease. R will lie between -1 to 0, and in between is absent correlation, no correlation. So R will be 0, because there is no change in one with other. So can you tell me now the most popular question of this topic? Overall correlation coefficient R lies between, combine all the three, absolutely right, -1 to +1, which may be either positive, negative, or absent correlation. So that is good to see all the FMGE and NEET PG students have marked this correctly. Okay, let's go further. Now it's your skills. I've given you a question where actually pen paper is not required. Weight of 6 students in kilogram, 46, 48, 50, 50, 52, 54. What is the mean weight? What is the median weight? What is the mode weight? Let us see how many of us mark this correctly. Mean is average. So sum divided by number of observations. Dr. Himanshu, your mathematics is very nice. You are the first student to answer this correctly. Mean, Dr. Vinay, you are also right. Sum, add them all, it is 300. Total number of students are 6. So mean weight is 50 kilogram. What is median? Median is middle value in ascending order. It is already in ascending order. There are two middle values, these two. So if there are two middle values, what we do? We take its average, 50 plus 50 by 2. So median weight is also 50. And what is mode? Mode is most frequent or repeated value in the data distribution. 50 is occurring twice, so that is mode. So by chance in this question, 50 mean, 50 median, 50 mode is correct. Thank you, Dr. Govind sir, Dr. Praveen sir, Dr. Pooh sir, Dr. Sparsh sir for being a part of this session. Also, thank you, Dr. Zainab ma'am and Dr. Dilip sir for being a part of this session. Okay, let's move further. Friends, also you must know, see, nowadays what is happening is your exam is not providing you. In National Board earlier, they used to give pen and paper. So either the questions will be so simple you can calculate mentally, or they will ask you theoretical questions or diagrams from stats. So let us look at 3 different questions. P-value significant if. Also, you can tell me what is p-value. Type 1 statistical error is, and what is the meaning of random in random sampling? Let us see how many of you get it correct. Okay, Dr. Shilpa is asking why give tough exam for FMG. Friends, you also know the answer. I also know the answer. Right? They give slightly tougher exam for FMG because they don't want the passing percentage to be very, very high. Otherwise, the private colleges will suffer in India and abroad. Okay. So P value is significant if. What is P value? P is probability of type 1 error. And it is significant if P value is less than 5% or 0.05. So type 1 error will occur if you can keep it below 5% or 0.05. You are correct. More significant. What is type 1 statistical error? When null hypothesis is true but rejected. See friends, here this topic I require generally 20-30 minutes to make a student understand. So I cannot go through the topic right now, but I can tell you the questions which are frequently asked. And this is easy. What is the meaning of random in random sampling? Random is not haphazard, rather it is very systematic. It means equal and known chance. Also tell me the classification of variables for body mass index and religion. Body mass index is quantitative, continuous, there are in between values, and polyautomous, multiple values are there. This was the latest question, religion. Religion is qualitative in nature. If you have attended my classes, reading my book, or you've seen the video of mine, or even any PSM teacher you have seen, you must have gone through these topics. Qualitative, it is discrete, and yet it is polyautomous. This we must know. Now, friends, after having gone through all the topics, last 3 hours, what I've done is I started from epidemiology, vaccines, screening, communicable, non-communicable, health programs. Then we discussed demography, family planning, sociology, health committees, health planning, healthcare system in India. We also discussed management techniques, biomedical waste management, occupational health, international health also we discussed, and so many topics we discussed. New programs also we discussed, and Anemia Bharat. Now, just relax. No need to write anything. Every exam comes with very, very strange questions. So I have tried to collate some of the strange, let's not say strange, some of the unique questions which we generally tend to miss in rapid fire round. So are you ready for the rapid fire round? Ideally, it should be done very fast. But since we are online, I'll go slightly slow for your benefit. So keep the fire in you alive. 3 hours you have done. 100% rapid revision is covered. Let us add few more questions to that. I have a strong feeling few may appear in the upcoming examinations of National Board. These are all National Board questions only. I have not created any question from my side. So let us start with the first question. What is the energy and protein content of breast milk? I will wait for your answer for each question. Consider you are getting 30 seconds. In exam, you will get 1 minute. So energy and protein content of breast milk. Yes, Dr. Inam, incubation period exam में आता है measles, hepatitis A, hepatitis B, staph, COVID. These are most frequently asked. Energy content is 65 kilocalories. Some of you are marking 67. They appear to be similar, but 67 is for cow's milk. Please remember. So 65 kilocalories per 100 ml. And protein content is 0.9 to 1.1 grams per 100 ml. Now a question. Students who will give me correct answer will get a chocolate from my side when we meet next. What is contraction phase of family cycle? Family cycle has 6 phases: formation, extension, complete extension, contraction, complete contraction, dissolution. Please go through it because this was the latest topic asked in one of the recent exams. What is the contraction phase? Contraction phase is starting from first child leaves home till last child leaves home. So please go through 5 stages of demographic cycle. 6 stages of family cycle so that there is no mistake. I'm not asking the number. In your exam, they didn't ask the stage of family cycle. They asked the exact description. So formation, extension, complete extension, contraction, complete contraction, dissolution or extinction. 6 phases are there. Okay. Those of you are correct, please remind me to take a chocolate when we meet next. No doubt. This is the family cycle. You can take a screenshot right now because this will help us later. In case you don't have time to go to my book or search or remember or going through the explanation video, just have a look at this. What I asked in this question was contraction. What has also been asked in the exam is formation. So you will have to go through actually all the 6, right? Okay, Dr. Alam is saying, sir, will this session be enough for the exam या कुछ और एक्स्ट्रा ही पढ़ना पड़ेगा? दोस्तों, नेशनल बोर्ड एक ऐसी बॉडी है जिसके लिए कभी भी कुछ इनफ नहीं होता. But I have tried to cover as much as possible, and this is based on last 6 papers of FMG and last 3 papers of NEET PG. So I've tried to cover as many topics as possible. Let us hope maximum comes from this, or at least your confidence level should be sky high right now. Let's move further. Rural areas under ESI, registered medical practitioner can give which type of benefit? Can anyone tell the answer? Yes, this session will not be deleted. I'm waiting for the answer. No one has given this answer to the latest question. Rural area. Suppose in rural area, there is no ESI facility. What they do, they involve the registered medical practitioners in that local area. And they are asked to given a particular type of benefit known as indirect pattern medical benefit. Please remember this question, friends. Let us hope it is repeated and we benefit from this particular question. Indirect pattern. Okay, then we move to next question. What is total fertility rate definition? Total fertility rate is total number of children born to a woman in her entire reproductive lifespan. This is also known as completed family size. One of the latest questions, 30 people are there at a camping site for garbage disposal. Which method they will use? It is a small group of people, they are doing a camp and they have to do garbage disposal. For such a small group, burial is a good enough method. Let us move forward. Okay, one of the recent questions, you are a medical officer of a PHC or you are sitting in a clinic in hospital and patient's family come to you who are not having high literacy level, they are at a lower literacy level or uneducated. You have to demonstrate or make them understand balanced diet. Which statistical diagram you will use? See, in a balanced diet, we recommend that fat should be 15 to 30%. Protein should be at least 15 to 20%. And rest should be given by carbohydrate. So, sorry, protein should be balanced first, 15-20%, then fats, and then carbohydrate. So how do you represent this? All of you, most of you are marking this correct. It is pie chart. So 10 to 15 protein, 15 to 30 fats, rest is by carbohydrate. Highest content of sodium is found in. Students were confused between soup and loaf of bread. What is the correct answer? I have discussed this in a previous session also, but I've kept it deliberately. Few things again so that we don't miss. Highest sodium content is in soup, or is it in loaf of bread? Yes, it is in loaf of bread. Bread has very, very high sodium content. Please remember, even a single slice is very high. Then there is a population of 10,000. trench method, we have to use sanitary landfill pit of depth 2 meters has to be dug. How much land area will be required per year? See, friend, this is something that we cannot calculate. This has been found by the authorities, and this has come as a value-based question also, always. 1 acre of land. So remember, 10,000 people, trench method, 2-meter depth, per year we require 1 acre of land. Then there was a question in your exam, Monica project. गाना सुना है ना वो, मोनिका ओ माय डार्लिंग, तो उसी तरीके से इस मोनिका को भी याद रखना है आपको. इट इज एक्चुअली एन एब्रीविएशन. मॉनिटरिंग ऑफ trends and determinants of what is CA? Yes, cardiovascular diseases. So this was a very big project for monitoring the trends and determinant are the respector or the causative agent of cardiovascular disorders. So this definitely we cannot forget. Then continuing with the rapid fire round, next set of questions. What is the brightness of point of source of light measured by using SI unit? See, brightness is actually luminous intensity. What is the SI unit for that? That is candela. So rather than asking you to remember everything, let's focus on the question candela. Okay, Monica Lewinsky. 12 बजे रात को आपको मोनिका लेविंस्की याद आई है मोनिका ट्रायल से. ओके, दैट्स अ गुड, एक्चुअली गुड वन. ओके, कैंडेला. देन global hunger index is based on 3 parameters. What are these 3 parameters? These are child undernourishment. We are talking of children only. Child undernourishment, number 1. Also, it is based on child underweight, and it is based on child mortality. Now, recently, instead of underweight, we have used wasting and stunting separately. So currently there are 4, but earlier the global hunger index was based on undernourishment, underweight, mortality. Currently, it is based on undernourishment, wasting, stunting, and mortality. So if they ask you, underweight has currently been replaced by wasting and stunting. That we definitely know what is that. Friends, then what is the causative agent of STD? Chancroid. Micro, medicine, PSM, gynae, you have to integrate in your mind. Friends, what is chancroid, the causative agent? Its incubation period is 3 to 5 days. Causative agent HPV, no, it's not HPV. I'm waiting for the correct answer. Okay, Dr. Guevara has given only the correct answer. Surprisingly, only 2-3 students have given correct. It is Haemophilus ducreyi, having an incubation period of 3 to 5 days. Donovenosis was asked. The causative agent is Calymaetobacterium granulomatis. Lymphogranuloma venerum. Causative agent is Chlamydia trachomatis, chlamydia, and syphilis we know, Treponema pallidum, and gonorrhea. The 5th STD we know, Neisseria gonorrhea. What is the home-based pregnancy testing kit provided by Government of India? Pregnancy testing kit, Government of India in RCS program providing is Nishchay. Please remember, Nikshay is online surveillance monitoring program for DOTS delivery in the country. Nishchay is a home-based pregnancy testing kit. I am seeing most of you are marking correctly, Dr. Sumit, Dr. Comfort. Friends, thank you so much for being a part of this session. Just another 2 minutes I will take. Your level of commitment is awesome. For a 3-hour session, if you can sit continuously, hats off to you. But that shows our commitment. We don't have to let our guard down. Final phase is going on. यही मौका है जब आपको अपनी गाड़ी को फाइनल गियर में रखना है और कंट्रोल में भी रखना है. तो जस्ट डोंट वरी अबाउट द रिजल्ट, फोकस ऑन द प्रोसेस, फोकस ऑन द एग्जाम, रिजल्ट अपने आप आपके फेवर में आएगा, आई एम 100% श्योर। दोस्तों जाने से पहले दोबारा बोलूंगा, चैनल को सब्सक्राइब कर लो, क्योंकि आपसे जुड़ने का अभी तो हमारे पास यही एक चैनल है। तो जब तक हम सोशल मीडिया से एक दूसरे से जुड़े रहेंगे, चाहे आप यूट्यूब देख लो, चाहे आप टेलीग्राम, इंस्टाग्राम, फेसबुक, सब जगह हम आपको मिलेंगे। बाकी ओआरआर क्लासेस में तो हम आपको मिलते रहेंगे, और आपके पास ऐप भी आएगी नीट पीजी एग्जाम के बाद। फ्रेंड्स, और बोर हो जाओ जब टाइम हो आपके पास, तो मेरे एमबीबीएस के किस्से देखना मेरे डॉक्टर विवेक जैन यूट्यूब चैनल पर है। तो एमबीबीएस के दौरान मेरे साथ क्या क्या हुआ, उसमें से कुछ सेंसर्ड चीजें भी मैंने आपको इसमें आपके साथ शेयर की है। होपफुली आपको पसंद आएगी, आपको पता चलेगा कि इंडिया में भी क्या क्या होता है। अगर आप फॉरेन मेडिकल ग्रेजुएट हो, इंडियन ग्रेजुएट्स तो जानते ही हैं हमारी एमबीबीएस में क्या क्या होता है, तो फॉरेन मेडिकल ग्रेजुएशन थोड़ी सी डिफरेंट है, लेकिन इंडियन वाली भी इंटरेस्टिंग है, राइट? ओके, तो लर्न विद द बेस्ट ऑन बिहाफ ऑफ द होल सेरिबेलम टीम, थैंक यू सो मच दोस्तों, प्रणाम, ऑल दी बेस्ट, बेस्ट ऑफ लक, अच्छा करो, नॉट जस्ट इन योर एग्जाम बट इन योर लाइफ ऑल्सो, गिव इन योर 100%, रिजल्ट के बारे में मत सोचो, अप एंड डाउन सक्सेस फेलियर आते रहते हैं, मेरी लाइफ में भी आए हैं, आपकी में भी आए होंगे, डोंट वरी अबाउट दैट, सिर्फ अपने एग्जाम पे फोकस करो, उसके लिए फाइनल टाइम। थैंक यू सो मच फ्रेंड्स, इतने सारे स्टूडेंट्स इतनी रात को दे आर शेयरिंग लव, थैंक यू सो मच दोस्तों। एक चीज जो मैं हमेशा मानता हूं, अब ये फाइनल टाइम है, तो यू आर सो क्लोज टू दी विक्ट्री, डोंट यू डेयर गिव अप नाउ। अब आप बिल्कुल उसके पास हो, एफएमजी की हो तो सिर्फ 7 दिन बचे, अगर आप नीट पीजी पे फोकस कर रहे हो तो आपके पास कुल 2 महीने बचे हैं। दोस्तों यही टाइम है, इस वक्त आप बिल्कुल भी कैन नॉट लेट डाउन, आपको अपनी जितनी भी आपने इतने सालों की मेहनत की है, इतने महीनों की मेहनत की है, उसको फाइनल गियर में रखो, आगे बढ़ते रहो, बिल्कुल मत सोचो, मेहनत करते रहो, क्वेश्चंस प्रैक्टिस करते रहो, रिवाइज करते रहो, रिवाइज 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 रिवाइज, बैलेंस हम आपका बना के रखेंगे, क्योंकि सेरिबेलम टीम का हमेशा यही एम है। तो फ्रेंड्स थैंक यू सो मच फ्रॉम द होल टीम ऑफ सेरिबेलम, वीडियो को आप देखो, इसको हम डेफिनेटली नहीं हटाएंगे। थैंक यू सो मच फ्रेंड्स फॉर बीइंग अ पार्ट ऑफ दिस सेशन, धन्यवाद दोस्तों, मजा आया आज के सेशन में, इतना लेवल ऑफ इंटरेक्शन देख के, और खासतौर से कि आपके आंसर ज्यादातर करेक्ट थे। देखो मैं सेशन को ना थोड़ा डिफिकल्ट बना सकता था, लेकिन मैंने सेशन को डिफिकल्ट इसलिए नहीं बनाया क्योंकि मेरे को आपको इंप्रेस नहीं करना है, आपका एग्जाम क्लियर कराना है। तो जैसा आपका एग्जाम आता है बिल्कुल वैसा ही सेशन था, अदरवाइज मैं भी कुछ डिफिकल्ट डिफिकल्ट क्वेश्चन डाल के इंप्रेस कर सकता हूँ, वो वेस्टेज ऑफ टाइम है। लेट्स कीप आवर अप्रोच सिंपल, जो अभी तक आप करके आ रहे हो वही करो, फोमो में मत पढ़ो, एनईएक्सटी को भूल जाओ, सिर्फ अपने आने वाले एफएमजी और नीट पीजी एग्जाम पे फोकस रखो, डेफिनेटली यू विल सक्सीड। सो थैंक यू सो मच फ्रेंड्स, धन्यवाद दोस्तों, बी सेफ, बी हेल्दी, सुरक्षित रहे और सफल बने, अपनी अपने फैमिली मेंबर्स का ध्यान रखिए, टाइम आने पे अपने वैक्सीन के डोजेस भी कोविड के लेते रहे। थैंक यू फ्रेंड्स, धन्यवाद दोस्तों। सेरिबेलम टीम, इस सेशन को अब हम खत्म कर सकते हैं, दोस्तों के साथ हम हमेशा जुड़े रहेंगे, धन्यवाद। गुड नाइट दोस्तों, आपके मैसेज ही पढ़ रहा हूँ। डॉक्टर गोविंद राय गर्ग सर भी हैं अभी सेशन के अंदर। बाय बाय, टेक केयर, स्टे सेफ, स्टे हेल्दी, कीप ऑन स्टडिंग फ्रेंड्स। I am also a big fan, big hug to you also dear, good night, take care। डॉक्टर अक्षय, डॉक्टर सैनी, डॉक्टर प्रतीक, डॉक्टर अतीक पांडे, डॉक्टर पीके, डॉक्टर टेंशन स्पैन ऑफ अ कॉकरोच, डॉक्टर प्रतीक सिंह, डॉक्टर गेल चौधरी, डॉक्टर निराली, डॉक्टर शिवम यादव, डॉक्टर ऋषभ गुप्ता, डॉक्टर गजेंद्र चौहान, डॉक्टर सैनी, डॉक्टर अंकित मित्तल, डॉक्टर सतबीर सिंह, डॉक्टर कुंज प्रजापति, यार नाम है, काश लाइव क्लास में होते तो और मजा आता, डॉक्टर राहुल कुमावत, डॉक्टर कुंडू, डॉक्टर अक्षय मिश्रा, थैंक यू सो मच फ्रेंड्स। श्रीनगर से डॉक्टर जैद बिन तारिक, धन्यवाद दोस्त इस सेशन में जुड़ने के लिए। नीट पीजी की क्लासेस भी आएंगी मेरी, बिल्कुल दोस्तों, नीट पीजी एफएमजी दोनों एग्जाम पे फोकस रखेंगे, आईएनआईसीटी एग्जाम के साथ भी बिल्कुल आएंगे। शुभम, वी कैन एंड दी सेशन, Kunal, if you are there, we can end the session. Love you, Dr. Mukesh. Thank you, Black Panther. Thank you, Dr. Isha Bhatt, Dr. Ankit Mittal. थैंक यू दोस्तों, प्रणाम सबको। डॉक्टर सिद्धार्थ टीएसएच लेवल के लिए ना, आई विल सजेस्ट कि आपने एंडोक्राइनोलॉजिस्ट या फिर एक एमडी मेडिसिन से बात करो, वो ज्यादा बेटर है। मैं बता सकता हूँ, बट क्लिनिशियन का काम क्लिनिशियन को करने देते हैं। थैंक यू डॉक्टर अंशुल शर्मा फ्रॉम रायपुर, मेरी वन ऑफ द फेवरेट सिटीज है, मेरा एक बहुत क्लोज फ्रेंड भी वहाँ पे रहता है। थैंक यू सो मच। यस, मिलने तो आएंगे डॉक्टर गोपाल पंडित, आप नहीं आओगे तो मैं आपसे मिलने आऊंगा, चिंता की बात ही नहीं है। सर कुणाल सो गया है, कुणाल तो सो गया होगा, लेकिन शुभम आप कहाँ पे हो? शुभम, इस सेशन को एंड कर दो।
या ठीक है सर।
ओके,
गुड नाइट सर।
गुड नाइट। गुजरात में बहुत बार आता हूँ डॉक्टर कुंज। बिल्कुल, इंशाल्लाह सब पास होंगे। सेल्फी तो जरूर लूंगा मैं आपके साथ, डॉक्टर अंकित पांडे। थैंक यू।